also to look at sort of the overall big picture. And one of the realities of the pressures that we're facing here in the province of Prince Edward Island, there's been healthcare in this province has been evolving just like it's been evolving everywhere else in the country. And I'm not going to sit up here and say that there's not pressures on the system. We have challenges, and that as we continue to embrace those challenges in respect to the volumes of chronic disease that we're trying to manage in communities across Prince Edward Island, and our population is getting older. How do we continue to provide supports and services, both at the acute level, subacute, convalescent, restorative? How do we provide services in this community? How do we provide services in the QEH, which Islanders from tip to tip access? How do we make sure that we have a good level of services for Islanders from across the province, provided when they're needed? Currently today, our second largest hospital is Etta Province. We've got a $50 million Etta Province budget behind the Queen Elizabeth Hospital, which does provide health care to all Islanders from communities across Prince Edward Island. So obviously tonight you'll see some good information, some good data, and the trends that are pushing down on our healthcare system are real, and they're not changing. And as we continue to build a system that traditionally moves away from a strong focus on acute care delivery to making sure that we have good, appropriate services in communities by the appropriate provider in the appropriate situation at the appropriate time. Healthcare in this province have grown, the budget has grown substantially. From 2007, it was in around $360 million. Today, healthcare budget for the entire province is in around $570 million. So that's an increase of over $200 million. So the challenge for government and health PEI is how do we continue to meet the needs, to make sure that we continue to have a good quality system, and to make sure that we're there for Islanders when they need the system the most, whether it's in your community or whether it's in a high-end acute service that you need that's not offered here, but offered maybe in Charlottetown or the Prince County Hospital, or even offered at the QE2 or the IWK or in St. John or Fredericton at the Chambers Hospital. So lots of pressures. Those are some very high-level realities. Healthcare in this country was built in the late 50s, publicly funded healthcare. And it was built on the model of partnership between the federal and the provincial governments at the time, at a model based on funding at 50 cents on every dollar. And this is certainly not a criticism of the current federal administration, but federal governments have come and gone, and that evolution of finances has dwindled down to about 18 cents on every dollar. The current federal government has said healthcare is a provincial jurisdiction. Here's your transfer payment. Do the best you can do with the resources you have. And so we basically have embraced that challenge. And I feel that we're very fortunate here in Prince Edward Island to have what we have. We've got 5 community hospitals. We've got 2 larger acute facilities, particularly at the PCH and the QEH. We have the provincial addiction facility at Mount Herbert, and we have the acute mental hospital in Hillsborough. So we have a range of facilities that provide a range of needs for Islanders from all across the province. And the challenge for us moving forward is looking at moving and making our system as an integrated, as an efficient system as we possibly can make it. Currently today, out of the 200 medical beds, which would be classified as acute care beds here in the province, there's approximately 80 individuals that are in those beds that are non-acute patients. So as a result, what we're seeing long wait times in emergency rooms and the 2 larger facilities at the Prince County Hospital and the Queen Elizabeth Hospital. We're seeing individuals sitting in observation rooms and sitting in stretchers, waiting to access beds that are not available at our 2 larger facilities. And the purpose of the integrated approach to using the system is making sure that we use every facility to its full capacity, that we're not at occupancy at 80% or 85% or 70%. We're using beds to the full capacity and providing the best quality care that we can provide to the individual or the Islander whoever that may is. So here's a story I'll share with you. I got a call the other night from a very upset individual in the city, upset that their mother was being transferred because she had gone past a point of her acute recovery and was demanding that she was not to be transferred to the community hospital in Surrey. And I said, I've got great confidence in the facility in Surrey. I got great confidence in the staff. Obviously, he was upset. I told him that as a politician and as the minister, I'm not getting involved. I believe that we've been repatriating, moving people out of the QEH and the PCH into communities now for some time, and it's been working. It is an interruption, obviously, for family. So the conversation ended. And 3 days later, the same individual called me back and apologized and said he could not believe the quality of care that he received in the community at the hospital, that his mother and family enjoyed their time there. So I think that's a message to me as minister that change is difficult, and when it really impacts you, it's upsetting, obviously. But once you walk through the experience, you get an appreciation for that we do have assets in our system, and those are our community hospitals. And we have approximately 1,000 islanders a day from Charlottetown right through to Tignish to Summerside, tip to tip, that are getting services that are coming in to the Prince County Hospital and coming into Charlottetown for some level of service. But we also have individuals that are living in those communities in Summerside and Charlottetown that are going out to communities for a certain level of care required at the back end of their procedure from the Prince County Hospital and the Queen Elizabeth Hospital. So we're fortunate here in Prince Edward Island to have what we have. We're a jurisdiction that's not a big province, and we have to take advantage of all the assets we have to make sure that everybody in this province at the appropriate time gets the best care and the best access to an appropriate level of service that is required, whether it's here in Montague or in Surrey or in Charlottetown or in Summerside, or whether it's needed in Halifax or Moncton, St. John or Fredericton, or whether it's out even beyond the Atlantic region. So with that being said, I want to thank you for coming out tonight. Looking forward to the questions. We'll have some real good information. I obviously won't be fielding all the questions. I have some staff. I'd certainly want to acknowledge Minister Roach, who's here tonight. I see Minister McIsaac here as well. I see MLA Colin Levy, Leader of the Opposition, at the back of the room as well. So Mike Redmond's here, NDP Leader of the party. So welcome everyone, and hopefully we have an informed discussion, and there's an opportunity to answer good questions, and certainly welcome the board from Health PEI as well. So thank you very much.
Thank you. So I'm Richard Wedge, and currently the interim CEO for Health PEI. I'm going to go through a number of slides to explain to members of the audience some of the direction that government has given to Health PEI. So as the Minister says, the ideal end point here is to make sure that all our current facilities are used to their fullest capacity. And as you can probably recognize, a number of these facilities in Alberton and O'Leary, Kings County, Tyne Valley, as well as Surrey. So just in summary, in Kings County Memorial Hospital here in the Montague area, there's not actually a whole lot of change going to occur in the services. All the current services are going to remain in terms of lab and x-ray and the emergency room that closes at 10 p.m. So that's all going to remain, as well as all the beds. We're going to have a little bit of a presentation around the advantages of the rapid response vehicles from Island EMS in a few minutes as well. That'll help lower some of the current ambulance response times. And then there's going to be a bit of a presentation about some enhancements that are going to be done to primary care, which is seeing your family doctor and advanced care nurses here in the community, including down the Murray River, Murray Harbour area as well, and then the 811 telehealth system. So again, there'll be a number of facilities that are going to be providing our acute care, including the emergency department, access to hospital beds. There will be our two facilities providing extended care. And then, as a lot of people will know, there are a number of other facilities around, whether they be community health centers or long-term care centers, community care facilities as well. So they'll all provide a different level of care. So a lot of people are confused about just what is acute care versus extended care, and so we put up some examples of extended care, and these are people that need extra time in hospital to restore their mobility or help them with their activities of daily living and eating and that kind of thing. Convalescent is people that do have some mobility problems, let's say post-operatively, and they need some more time. And sometimes it's because of the layout of their home, when they might live on a second floor and they have to get a bit more strength. Respite care to allow families who are looking after people with chronic disease to give them a break while they take some time off for themselves. And then, of course, palliative care for people requiring end of life. So those are the sort of things that are offered in extended care. And these are, it's important to realize that extended care is not the same as long-term care. Long-term care is actually people in their new home because they need 24-hour nursing care, and this is the stage of life that they're at. So extended care and long-term care are actually two different things completely. So as a reminder to the audience about the government announcement a few weeks ago now, Stewart Memorial Hospital is going to be converted into a 23-bed long-term care facility. The Community Hospital O'Leary and the Surrey Hospital are going to become extended care facilities. Western Hospital and Kings County Hospital will continue to provide acute care, and Prince County Hospital and Queen Elizabeth Hospital will continue to be our specialty referral hospitals. We left this slide in, which was for the Western Hospital, just because there may be some questions in the audience around the Collaborative Emergency Centre that's going to be set up in the Western Hospital. And essentially what happens there is the emergency room is going to continue the same as the emergency room here at Kings County Memorial Hospital, except at 8 p.m. the physicians will be off shift and heading home. There will be two other health professionals. The model is not quite determined yet whether it's going to be two nurses or a nurse and a paramedic. And they will be there to have access for the remaining 12 hours until 8 o'clock the next morning to anybody that comes in. So they may assess the patient and decide to bring them back in the morning to see the physician. They may assess the patient and send them back to see their own physician in their own clinic, or they may assess the patient and send them on to Prince County Hospital. This slide is just to kind of show you where people in the Kings County area, the larger Kings County area, actually go for acute care now. As you can see, the blue dial is actually the Queen Elizabeth Hospital. That's where the majority of acute care occurs for Kings County residents. That's not just Montague, that's for all of Kings County. The red section of the pie is the Kings County Memorial Hospital. That's about 24%. So combined, the two is 84% of the people are already either in Montague or Charlottetown. There's very few up in the Summerside area. Of course, there's about 16% in the Surrey area as well, and very, very few to none in West Prince. It's a slide to show sort of some of the situation that's occurring in our hospitals now. On average, there's about 12 people a day. That's the large blue. I don't know if this pointer actually will work on there, but the large blue line is about 12 patients a day that are admitted to the hospital at the Queen Elizabeth Hospital but don't actually have a bed to go to, so they receive care on a stretcher. At the Prince County Hospital, there's about 2 or 2.5 people a day who are admitted to the hospital and stay in the emergency room for all or part of their care. At the Kings County Memorial Hospital, it's the small one, and it's, as you can see, it says 0.5. So about every second day, there's somebody that stays in the emergency room because they don't have a bed available. On this one, just to point out, sorry, there we go. Just the one on the right-hand side. This is the current number of beds. There's about 17 people out of the 30 beds at Kings County Memorial Hospital that are acute care, and about 13 patients who are there with some sort of extended care currently, on average over the past year. So basically acute care is a bit more than half of the Kings County Hospital now. These are the occupancy rates over the last 3 years, the red one being Kings County Memorial Hospital. As you can see, it's essentially 101% occupied. So it is currently a fully occupied hospital now. The 811 telehealth system is basically a 24-hour day, 365-day access to a health professional on the other end of a line who's able to answer any particular health concerns that people may have, whether it's a serious medical problem or just a health question that they want some help with. So it's available 24 hours a day, 365 days of the year, and it's available in multiple languages. So people, it'll be of help to some of our immigrant community. We've been showing some examples of different patients that are not actually receiving the best of care currently. So we picked 3 from the Montague area. And the first one is a 84-year-old lady who had a bladder dysfunction and was admitted to the hospital and actually stayed on a stretcher in the emergency room for 4 days. The second one is a 91-year-old female who was kept on a stretcher as well. For dizziness. So obviously it's not a very great place to be for 3 days as well. And then the last one is an 80-year-old male with abdominal pain, and this one was kind of particularly troubling because they kept being transferred to the medical floor at KCMH, and then in the morning, because they didn't have a bed, back to emergency for the day, and then back to emergency at nighttime. So that went on for 3 or 4 days as well. So these are the sort of things that we want to try and avoid by trying to put people in the right place, receive the right care at the right time. Yeah.
Did they not move the first 2 patients to the floor at night and then return them to the
They may have. I'm just relating some stories that were related to me, so I wasn't sure of the details on everybody.
like they stayed in the emergency department?
Yeah. I don't think anybody actually stays in the emergency department. They probably all went to the floor and back, but I just didn't get the rest of the story from them. These were just sort of examples of people that are asking about their family members. So that's kind of a summary of the changes that were announced a few months ago. We're going to have a representative of Island EMS, Matt Crossman, to come up. Is it Matt now? Or you're next. I guess Marilyn.
There you go.
Thank you.
Good evening. My name is Marilyn Barrett, and I'm Director of Primary Care Networks and Chronic Disease Prevention and Management for Health PEI. And so I just want to tell you right quick about the primary care networks. So in Montague, you are a part of the Kings Primary Care Network. So that consists of Montague, Surrey, and most of Kings County. And so primary care networks, those are geographic areas that have divided the province into 5. There's West Prince, East Prince, Queens East, which would include Central Queens and Hunter River, and Charlottetown, and then Queens East would include Charlottetown, Stratford area as extending out to Morel, and then Kings from there out. And so our goals, of course, are to enhance patient access and to integrate services and provide accountability and sustainability of health. So we have developed teams, and those teams consist of physicians, nurses, diabetes educators, including dietitians, and mental health staff in some of the networks as we build them up. So in the Montague area, we still have 1 physician vacancy that we've been recruiting for. And as well, we have a nurse practitioner vacancy that we're currently recruiting. We did have a site visit last week, so fingers crossed. We've certainly, the nurses at the clinic will tell you, they've invested heavily in education over the last couple of years, particularly around COPD care and INR management, people that are on blood thinners, looking at their clotting times, and hypertension and diabetes. We've also done an advanced clinical access project with Dr. Campbell at the health center, working on opening up some appointments. And we're also doing renovations at the health center in Montague. The lower level is being renovated to accommodate the entire team. We're going to move the diabetes team over and have the primary care nurses work out of the lower level. We also do outreach to Murray River, as Dr. Wedge mentioned, and so we have COPD programs run out of there, as well as home care, and we've just started a Living Healthy Life program on the 25th of April. So a couple of improvements that have been made at the Montague Health Centre include the telephone tree. We had concerns expressed by some of the residents of the Montague area that they were having trouble getting through to the clinics. So we've invested and put in a telephone tree to try and help assist callers. We've also have a prescription refill program for patients of salaried physicians, and again, working on a collaborative approach to managing your diabetes. Thank you very much.
Thank you very much, Minister, and everybody in attendance tonight for the chance to address everyone. As said previously, my name is Matt Crossman. I am the General Manager for Island EMS. I'm just going to go over a few slides tonight just to talk about some of the new enhancements into our EMS system and give you a little bit of background. There'll be time for question at the end tonight, and for some reason, if you didn't get a chance to ask your question or you didn't feel comfortable, you can always go on our website or call our general inquiry line and get myself at any time. We started to operate the ground ambulance service in Prince Edward Island in 2006. The previous 5 owner and operators did a great job operating the different systems throughout, but some of the major benefits to providing a provincial service or a service under one umbrella is that we're able to standardize the level of care across the island. So regardless whether you live in Montague, Charlottetown, Surrey, Alberton, Tignish, you get the same level of care. We really try hard every day to improve the level of service, and we'll go over some of the enhancements which we've made over the last couple of years, but we really do try and provide a service to all islanders, and we try and put our resources in the right locations at the right times. One of the unfortunate things previously to the 5 operators is they operated within their specific areas. With the new provincial system, we're able to operate across the island. So for instance, if an area such as Montague becomes depleted, we can pull units from Charlottetown into Montague to cover the areas. So we're very excited about the new enhancements that are coming. We've been operating a long-term service contract since 2006. We have over 140 paramedics, and with these new initiatives, we're looking to hire an additional 7 or 8 full-time positions. We have ranging in paramedic scopes from primary care to intermediate care to advanced care. All of our units are now staffed with advanced life support paramedics, and we're getting a full complement of staff, so we're very excited about the level of care which we're able to deliver. Currently, without the enhancements, we have 19 units across the island, ranging from a multi-patient transfer unit to our Mercedes type ambulances to our modular style ambulances. And as we start to go through some of the options today, we'll talk about what type of vehicles are going to be added into the system. Some of the major advantages which I talked about before is one of the big things is we have a standardized dispatch center. Medicom Atlantic, who is our dispatch service, provides the emergency medical service dispatch for all of Island EMS calls. They also take all of the 911 calls across Prince Edward Island, dispatch 34 out of the 36 existing fire departments, and we're very lucky to be able to have that quick access to information. It really does help improve the quickness that our crews are responding. We've been able to standardize our fleet across the island so that regardless where our paramedics enter an ambulance, they're all laid out the same. They all have the exact same technology and equipment. We're currently testing out, and all of our units are now equipped with capability to transmit 12-lead ECG transmissions to the hospital. So what that means is as soon as our paramedics arrive on scene and hook up our cardiac monitor, we're able to do a 12-lead ECG transmission and send it right from the patient's residence to the physician in either Prince County or Queen Elizabeth. And this helps enable the hospital to get ready for when we do arrive and administer thrombolytics. We've really standardized the scope, and not only have we standardized the scope of practice, but we've also enhanced it to a maximum, as you'll find across any service across Canada. We do have a booth set up in the corner here that outlines some of the skills which the paramedics are able to deliver. Our paramedics are really able to deliver a high level of quality of care. As soon as we arrive on scene, we're able to administer high levels of medication, really start a fast initiation treatment plan. And one of the great benefits as well is we're able to coordinate with the local facilities and hospitals and physicians and nurses and make sure that they're aware of the patient condition before we actually arrive. And this helps prepare the amount of quality of service they get by the time they arrive. The physicians and the nurses and the staff are prepared, know what the patient's condition is like, and they're able to start the treatment that much more quickly. We're really looking as we go over time to improve our quality of standards. We audit 100% of our patient care records. We look at our paramedics' skill level and we test them manually. We do a lot of clinical in-services, and we're very proud of the level of care that our paramedics are able to provide. As I said before, the treatment really starts at the time the 911 call comes in. We're able to get the right resources to the patient's house as quickly as possible, and our patients are really able to start the triage process then. Not all of our calls are emergencies, but we are able to respond quickly and notify the staff and start life-saving treatment right away. With the new enhancements, there's a couple of enhancements. There's a Eastern Rapid Response Unit, which will be located in Montague, Surrey area, and we also have a Western Rapid Response Unit, which will be primarily out of the O'Leary, Alberton area. These Rapid Response Units are SUV-type vehicles, which are fully equipped the same as an ambulance, except for the transport capability. Our paramedics are going to be able to start treatment immediately. Another ambulance will be dispatched as well. The benefit of this is when an ambulance responds to the scene right now, they have to start treatment, transport the patient to the local facility, and it takes them a while to become available. What the benefit of the rapid response unit is going to be, we're going to have a highly trained advanced care paramedic that's going to be able to respond to the scene, start treatment immediately. They're going to be able to transfer care over to the oncoming crew, and then they're going to be available for a call again. So instead of that resource leaving the communities, it's going to be available for the next call. A lot of the times now, that's what happens is we have units within our locations, but we'll get hit with multiple calls, and that can sometimes impact the quickness that we arrive to a scene. We look at all of our response times very closely. We look at the monthly, quarterly, and annually. And just so you guys know, our stats are published on our website, islandems.ca. You can go on there and look at our response times. When you do look at our response times, you'll see what's called a 90th percentile. A lot of people think that we kind of cherry pick the calls that we put on. What the 90th percentile is 100% of all of our calls. So when you look at that stat, it includes the longest call and the quickest call that we've done in those communities. What it does is it just provides you with an average, and that's kind of the national standard, is why we use the 90th percentile. That's what most services use, and it's just a baseline so that we have something to look at. Another thing that's important for you to know as well is all of our stats are 100% of our calls inclusive. There's no exceptions whatsoever. So in a lot of areas when you have inclement weather or high demand of service, such things as Cavendish Beach Music Festival, when there's a large majority of calls, those don't count for your statistics. So for us, we're actually providing 100% of the data, and we're really proud of the response times, but always looking for ways to improve it, and we really think this is going to make a big difference. Lastly, we have what's called our ambulance transfer unit. We also think this is going to be a major improvement into the system, and also all of our impact on all of our response times. Right now, our ambulances perform our inter-facility transfers, and they're about a third of our call volume right now across the island. When our ambulances start out the day, we have our schedule planned. We have a bunch of patients that are ready for pickup. We know exactly when the appointments are for a lot of them, and we really plan our day. But unfortunately, due to emergencies, a lot of the time our ambulances get rerouted to a higher emergency call, such as a motor vehicle collision or somebody that's having chest pain. And what happens is, with that delay, we could be on scene for an hour or two, and it really impacts the rest of the day. Not only is that first patient now delayed, but multiple patients are delayed. So with the ambulance transfer unit, it's going to be outside of our system status plan, and they're not going to respond to emergencies. They're going to respond to scheduled transfers. There's still a high-level trained paramedic, 2 paramedics inside the unit, but it enables us to meet the response times of the facilities, the patient, and also within our community. So we're very excited. The unit is a Mercedes type unit. It's equipped with a wheelchair lift and also a stretcher lift, a hydraulic lift, which will help reduce back injuries amongst our staff. So we're very excited about introducing this new initiative and what it's going to do to our overall response times. Thank you again for your time, and I'll look forward to some questions.
Good evening. I'm Marnie McCrae. I'm manager of the Recruitment and Retention Secretariat under the Department of Health and Wellness. I've been in this role for probably about 3.5 years now. And just to give you a sense, some of the challenges we face since in that time period that I've been there are around some of the specialty areas and our rural family physician recruitment. So we currently have the vacancy in Montague, and we have 2 in Surrey and 1 in West Prince. One of the things that we have the benefit of is that our rural recruitment is not remote like you see in some of the rest of the country. So in Montague, we have a complement of 8 physicians and 1 vacancy currently. We were very fortunate to recruit Dr. Fancy to the Montague area, and Dr. Fancy was one of our family medicine residency training program graduates. So she came and became part of the program here in the province. So this program has been in place over the last few years. When medical students complete their training at medical schools, they come and do residency training. And this program has been very beneficial to us in the province. Last year, all of the graduates, the 5 who completed the training, stayed in PEI. And so we're really fortunate to have it. This year, there'll be 4 completing the training and 3 are signed on now to remain in the province. And we're just waiting on hopefully a 4th. We've had a number of investments. Just to give you a sense of your area, over the last 10 years, we've had 23 site visits to the community where we've brought physicians in to meet with the folks in the hospitals, to meet with physicians, to tour the community, to meet with real estate while they're here, to visit schools if they have children. So when we come for a site visit, they have a good tour of the whole community and get a real sense of what's involved. The locums to your community as well, we've had 34 locums here over the past 10 years. Now our locums are the shorter term physicians that in some cases are here for a couple of weeks to provide support, in other cases may be here for a year. We also have, as Marilyn mentioned earlier, 1 nurse practitioner vacancy. We've had significant efforts underway for nurse practitioner recruitment, and they are paying off. Over the last few months, we've recruited 1 for Charlottetown and 1 for Hunter River. We did have a site visit here to this community over the last few weeks. And we have 3 graduates coming out of the program at UPEI, the new program that with the first group of nurse practitioner graduates coming out in the fall. So we're excited and hoping they'll decide to stay on PEI. There are challenges, certainly in recruitment, as I mentioned. Rural physician recruitment can be a challenge. New physicians are looking for work-life balance. It's really important to them that they have that. And sometimes when we look at these new residents just coming out, they prefer more of a clinical experience rather than providing a solo ER coverage. Okay, so they like to have folks with them and not be on their own with the ER coverage. That's what we're finding in some cases. A new opportunity that we've presented this year, and we have advertised all across the country, is for a family medicine sponsorship program. It's open to all Canadian second-year medical students, and the focus on this is that we recruit, upon completion of training, folks back to the province, and we will at that point determine the area of greatest need at the time that they complete their training. And that's where those folks are committing for 5 years. Now, the funding for this is $110,000 over the course of their training. So we've got 3 we're hoping to have before too long sign on, and then we'll see where we go from there. But it is another new program, another way to recruit to our rural communities. So just to give you a quick sense of some of our ongoing efforts, our recent ads just for Canadian Doctors Magazine, Medical Post, Canadian Medical Association Journal, Canada MD website. So we do ads in all of these journals. We do regular ads focused on different areas. We have a job fair coming up that we're quite excited about and hoping to find some success in. It's a primary care today, focused in primary care. In Ontario, there's 2,400 physicians and nurse practitioners in attendance. And we will be there presenting with our booth and hopefully recruiting. We have very competitive incentives. So we look at what's happening across the rest of our country, and I have a budget that allows for very competitive incentives. So if you're going to come to our community, you're a physician, family physician, and it's a rural community, it's a $35,000 return in service agreement, and you're signing on for a 3-year commitment with us. We also have moving expense allowances as well with that, and depending where you're locating from, it can be between $10,000 to $20,000. So those are very competitive with the rest of the country. Our applications are closing for that new sponsorship program mid-May. And we have an active retention and integration committee here now in this community, and we're excited about that. Your mayor, town administrator, the active communities are all very involved in helping to support this integration and retention of newcomers to your community. And this program was implemented just over this past year. So we look forward to that type of support when we recruit these new folks to your communities. Newcomers Association has been very involved in that, and staff from our section as well have been very involved. So we want to assure you that our recruitment efforts will continue till we fill those remaining vacancies in the province. Thank you.
Thanks, Marnie, and to all of the speakers. And now it's time to hear from you. We are inviting questions now. And what I'm going to do is ask you when you come up to the mic right up here to say your name. And if you can't come up to the mic, I have a handheld one, so I'll come to you if you just wave at me. And I'd like to reiterate a comment that Minister Roach made earlier. I've been to 4 or 5 of these sessions, and I do recognize faces. I recognize some faces of folks from the Montague area and also some folks who are not from the Montague area. And I do really want to make sure that the folks who live here have an opportunity to make their comments and ask their questions first. So I'm going to depend on you to help me out with that, to make sure that we're not trying to get people not to ask questions, but we do want to make sure, since we are in the Montague area, that they get a chance first. And the folks up here are ready to respond. So look, we have a lineup already. You go first, and I'm hoping you're from the Montague area.
Thank you, Carol. I spent the afternoon with you in North River.
You have to go a little more.
By the way, today. Thank you. Mr. Minister and staff, first of all, I'd like to say a warm and friendly welcome to you, to the town of Montague on behalf of the town council and all the residents. It's a pleasure to have you with us this evening. I want to also say at the beginning that everything I've heard so far sounds perfect, but it's not a perfect world by any means. And having said that, Mr. Minister, Montague had a hospital during the First World War. We had a new hospital built after the Second World War. We had a new hospital built in 1970. And since then, we've lost a lot of services, and the people here don't want to lose any more. So I want to be as gentle as I can with you, Mr. Minister, in saying that. We've lost... Since 1970, we've lost the surgeons that we've had. We lost the maternity wing. we lost the dialysis, and we've lost the 24 emergency. So we've lost 4 things over the last 30 years, and we do not want to lose any other services than we've already lost. This evening, I want to say that we in the town of Montague and surrounding areas had many concerns over the recent announcement of the changes to the island health system, and we need more details about our own Kings County Memorial Hospital. We are concerned that in 2013, in 2023, we'll have less services than we have today. I like what I saw this evening. The presentation is well done. You are providing new things for the future, and that's good news. But at the same time, we are worried about the Kings County Memorial Hospital. It's been here since the beginning of the First World War. We've had a very busy town. We have 14,000 cars cross our bridge every day. We're a busy service center. We're a busy community, and we need and want a hospital. We at least want one hospital in Kings County. If we lose one, we don't want to lose 2. My question, Mr. Minister, will Kings County Memorial Hospital have your assurance that it will continue to provide acute care and emergency service at the present level for Montague and this region of Kings County?
Thank you very much, Mayor Collins, and that certainly is a commitment. Obviously, government recognizes that healthcare has evolved in this province, and I know that in various communities there was babies delivered, there was surgeries being performed, and over the last 20 years, I think we've seen a constant evolution of how healthcare has been delivered. So certainly our government sees this facility here in this community as a key asset. Obviously, as you see, not much has changed or will change. The services that we wrap around with the telehealth and the rapid response vehicles hopefully will continue to serve the community, plus as well as the investments in primary health care. So certainly our government's committed to the services that are here. And we really, as I've said before, in communities all across Prince Rupert, we need to make sure we're providing quality services at the appropriate time in the appropriate situation. We need to keep people out of acute care beds. And how do we do that? We need to make sure that we're providing services all across the province. We recognize that the population is aging, and we need to manage that aging group, the baby boomers that are between 50 and 70 right now, and the chronic disease, and keep them in the communities and manage them as best we can. So thank you.
Just one other comment before I leave the mic, Mr. Minister. I wrote you a letter on April the 4th. I faxed it to you on April the 4th. I hard copied it to you a few days later. You have not responded. I'll give it to you again tonight and hope I hear from you.
Actually, it usually takes, I've been pretty busy these days, so actually I've got a hard copy and it's on its way. Thanks, no problem.
Mr. Minister, my name is Harvey McDonald. I'm from the Montague area, and I have a couple of questions, one statement to make, and one of the big things is in this statement that was made, the presentation that was made, the ambulance is under Health PEI. Is that not owned by a Pacific private company out of Halifax, Nova Scotia?
Thank you, sir, for your question. Yes, it is. It's owned by Montague EMS. Montague EMS is our corporate company, and Island EMS is the company here on Prince Edward Island. We operate under a long-term service contract with Health PEI and the Department of Health, and that was commenced in 2006.
So it is a private company?
It is, yeah. We are a private company. Our company, Montague EMS, our corporate company, owns and operates services in New Brunswick, Nova Scotia, Prince Edward Island, and also some other services around Canada as well.
Okay. And the next thing is, it's kind of a selfish act for me to be up here wondering, I had a letter received from Health PEI about surgery for myself that's been denied, that the Health PEI does not support the payment for the surgery. And what gets me the worst of it is it's something that has to do with chronic pain that happened 7 years ago, not of my doings. And on the bottom of the footnote of the letter, it says, "One island future, one island health system." I'm reading it, thinking, what, except for me? Oh, and I know it's not, it might be selfish on my part, but when is there going to be somebody else in the crowd? When is it going to be, you know, who's next? And the hospital that we have, like, our doctors are very well, are very good. The ones that, the changes that you're making, the doctors that are going to be there, are they not going to lose skills over time because they're changing and they're not able to stitch, they're losing skills? Where's that going to leave us in the future? Look, we all know we're getting older. It's not sneaking up on anybody. We're all about the same age. So if you want a copy of the letter, it'd be great. I have a copy at home, and I'd like to know why, if you wouldn't mind.
Thanks, sir.
So we obviously don't want to get into your personal situation, but we'll have a look at the letter and respond to you either by calling or mail, or what would you prefer?
Phone call would be great.
Phone call.
My telephone number is 902-838-3830.
Sorry, you're fast. But in response to the question around the skills of the physicians, the plan is that the current emergency room is staying in the Montague area, so obviously whatever emergencies come in or any primary care things that come in will be the same. I highly doubt that there's going to be any changes to those kind of skills. Is that what you're alluding to here, or are you talking about a different community?
I was talking about the communities that are going to have the emergency rooms and stuff.
But they don't have emergency rooms now, though. So we have 4 emergency rooms now, and we're still going to have 4 in the end.
Thanks.
Okay, thanks.
Hi, my name is Leonard Monroe. I'm just an old guy here from Montague with a few medical problems that I'm not going to discuss here tonight. I've always been very interested in our hospital. I was chairman of the hospital board here for a number of years, and it saddens me to see the way things are deteriorating now. The hospital needs some upgrades. Our staff there is excellent. They've been there a long time, and we're very, very fortunate. We always were. I was always so proud when I went to the Hospital Association meetings when our hospital would be the cleanest one on the island. People are dedicated. The thing that bothers me the most is why we can't have our hospital open here 24 hours a day. It'd be great if we all get sick. It's great if we can all wait till 8 o'clock in the morning or before 10 o'clock at night to get sick. But unfortunately, that's not the way it happens. I'm looking at the manager of the ambulance service here. If you're living in Surrey or in Murray Harbor or Montague, and you're expecting the ambulance to be your savior, you better have Plan B, because it just doesn't work. I'll tell you, and I'm not going to take up too much time, but I'll tell you this experience last fall. My wife and I were going into Charlottetown, and I tell this story to people because I'm talking about the hospital here all the time. The car didn't seem to be steering right, so I pulled into Cherry Valley Corner to check to see if my tire was going flat or something. The ambulance is parked there, and I happened to know the young lady that was there. And I went over and I asked her, I said, "What, are you waiting for an accident here to happen?" She said, "No, I'm covering my area." I said, "What's your area?" Well, she said, "This is not for publication. I'm doing from Wood Islands to Mount Stewart to East Point." I said, "Where the hell are the other ambulances?" She said, "They're off island." That told me, if you're going to have a heart attack and you're going to look for an ambulance, you better have a friend that you can dial to get you there, because that just doesn't work here. And you know, it's just the facts of life here. And I just have a couple more things, and then
Sure.
you can respond. I can't understand. Alberton has they have their hospital open 24 hours with nurse practitioners. What's wrong with this hospital here, why we can't have that? I understand because I've gone through it with the doctors here don't want to work at night or weekends, and I can understand that. But there has to be someone look after us, and like this, I'll tell you right up front here, hospital care is not only for the people of Charlottetown and Summerside. There's a rural area here too. And we don't expect any more, but we don't expect any less. And I noticed there with everyone that says that this new health plan is a good idea, 99.5 are from Charlottetown or Summerside. If I looked out my window and I could see the Queen Elizabeth Hospital or the Prince County Hospital, I'd be happy too. You know, and then people say to me, that some of them there that'll say, well, you're only 25 minutes from Montague to the hospital. You know, my son lives up north and he's got 2,700 miles. If he wants to live in that, great. I couldn't with my heart condition. I couldn't. I'm hardly close enough to the hospital now. It just comes down that I think the governments have to realize there's rural areas here too. Our town is dying here. If you close the hospital down, when you close it at night, we used to have a lot of people come in here that sold their farms and they gave up their fishing fleet. They come into Montague to retire. Now when they hear, and most of them have, like everyone, you get a certain age, you have health problems. Most of the people that used to come in here now, they're filling those units in Charlottetown, probably in your districts, that they can't build them quick enough. You wouldn't know the city. They're not coming into Montague anymore. They're not going into Surrey anymore. They're going where the health care is. And if you take that away from us, it's just another death knock for the town and the area. Thank you very much.
Thank you, sir. Thank you, sir. I'll just address it just very quickly and just talk a little bit. You're right, sir. Off-island transfers is one of the pressures on our system. We've done a lot of things over the last few months to try and limit the impact that has on our service. On any average day, we could have 5 off-island transfers to Halifax or St. John. And we've really tried to improve our coordination. We've just recently met with both provinces, New Brunswick and Nova Scotia, to try and coordinate better so that our units are going over full and coming back full, which limits the amount of ambulances that go off island. There are times, sir, within our communities where our vehicles are roadside, and sometimes that does mean that we're covering multiple areas. But one of the great things with the provincial system is it actually gives us units to be able to do that. If we were covering this specific area and we didn't have any additional units which we could pull in, and there are times, because I have worked in private services, where all of your vehicles are on emergency calls. This gives us an ability to pull vehicles from other areas when they're not on calls. The addition of these 3 units is going to have a large impact, not just here in Montague, but across the island, because it's going to add additional resources into the system. And specifically, the rapid response units are going to make it so that within the communities, there's going to be a vehicle available at all times to respond to calls. So I do appreciate your question, sir, and I think it's a valid concern. And I encourage you at any time privately, if you have any questions or concerns, or you're concerned about the service, I would love to have a talk with you. And we always look for ways to make a better service. So thank you.
Mr. Minister and panel, thank you for coming to Montague this evening to speak to the proposed healthcare changes. My name is Thelma Johnston, and I'm the coordinator for Hospice of Southern Kings County. And as I'm sure you're aware, we provide support to people in end-of-life situations and their families. To that end, looking at your presentation this evening, we see that Surrey, as an extended care hospital, will have palliative care beds in that hospital. We currently have 3 palliative care beds in the Montague Hospital. If the Kings County Memorial Hospital is to be an acute care hospital, are you planning to have palliative care beds in the hospital? And have you also looked at, I see you had statistics, so there's a couple of questions. The palliative care allotment in Kings County, palliative care bed allotment. And the second question is, you have statistics up there about how health services are allotted, or how they are statistically reviewed in this area. I'm wondering, have you also looked at the statistics for palliative care services in the Kings County area?
Yeah, we have looked at palliative care in Kings County. The Kings County Hospital, again, is going to be our main acute care hospital. We're going to have acute beds to support the emergency department. But as you can see on the slides, not all the beds are necessarily going to be acute. So there will be some patients that are there for convalescence from the Montague area, for palliative care, for respite, and that kind of thing, just as they do now. But we do want to dedicate some of the beds for acute care because we need them to support the emergency department. So we do have 2 palliative care programs underway. One is our home palliative care program that's supported, as well as the in-hospital one that we support as well. So that'll continue.
So you will be keeping the palliative care beds at the Kings County Memorial Hospital?
That's right, yeah,
Yes.
and Surrey.
Oh,
Yeah.
and Surrey.
Yeah.
And just a further aside, hospice board members were in O'Leary last week to look at their palliative care unit.
Mm-hmm.
An absolutely excellent job done there, and we would love to see something like that in this area.
Yeah, So the staff at the Community Hospital O'Leary, we're very proactive in trying to make that area to be especially made for
Yes.
palliative care.
Yes.
They have 4 beds. They don't always use the 4 beds, but they are available when needed. Yeah.
Yes. Well, there were 2 beds being used. I won't keep up much time here, but there were 2 beds being used. I understand it's quite busy, unfortunately, and it's a wonderful model. And if anyone has a chance to see that model, they should go up there because they've done an absolutely wonderful job. And we would like to have that in Kings County.
Yeah.
Thank you.
Sounds good. Yeah.
My name is Mary Boyd. I'm the chair of the PEI Health Coalition, and I live near the Kings County line. Anyway, we do have a few things that concern us about the hearings. First of all, Romano, in his report, made the statement that Medicare belongs to the people. So the first question that arises in our minds is, if Medicare belongs to the people, why wouldn't the consultation start with the people before any changes are made or announced? So that's a question. I attended some of the other public meetings, and my heart goes out to the people who feel divested of hospital care and acute care beds closing, surgery ending, emergency closing, and so on, because with that they know that the skilled care goes out of the area, doctors, nurses, and other skilled care. And people do need facilities close to home, and they do need care close to home. I talked to my colleagues in Ontario, and they said on the one hand, the same changes are happening, and they say that they're freeing up beds for acute care. On the other hand, they're shutting them down and shutting down facilities. Also, when that happened in Saskatchewan in the 1990s, the government of the day got a rude awakening. Dr. Moses Cody, the great leader of the Antigonish movement, said, "Ask the local people and they will tell you where the ice is thin." I think the local people know where the ice is thin in healthcare and PEI and in the rural areas, and it's difficult to think that they haven't been asked first. People also believe that these changes don't save money. They add a lot in ambulance costs, and that's something that has to be costed out. And then that often the remaining ERs are completely overrun. We were happy to see that in your list of changes that you did add the 811 service, but we are quite dismayed that it's a privatized service. We were asking that you institute 811, but under the public system. It's kind of disconcerting to see so much drifting toward the private sector. As far as the ambulance services, I heard a lot of people speak in Surrey about the fact that the service has actually been slower with the new addition. So I want to make a quote from the Ontario paramedics. 50 of them were interviewed about the changes there, which are similar here, and this is what they said. The claims that equivalent or better care could result from the closure of a local emergency department led the Ontario Health Coalition to in-depth interviews with 50 paramedics of different levels of training in every geographic area of Ontario. The goal was to determine the clinical implications for patients of closing down local community emergency departments and the impact on regional ambulance services. Could local emergency care not only be replaced in ambulances, but patients could somehow be safer traveling further for their emergencies? The answer was a resounding no. So that's something that we need to be concerned about. Now, I also would like to raise the point about having to make changes because of an aging population, because the national statistics say that it's the last year of a person's life that's costly, and that takes up less than 1% of the whole health budget. So aging population is not necessarily equivalent to increased costs. And I heard you say, Mr. Minister, tonight and before, and this concerns me as well, because I do know, as you said, that when Medicare began, it was cost-shared 50-50 by the provinces and the federal government. I heard you say that you were going to adjust to Mr. Harper's plan to wipe his hands federally of health care and put it onto the provinces. That's where you should be challenged to put up a really good fight against that trend. There's no way, there's no way you should ever adjust to that. Mr. Harper has to be made responsible for health care in Canada, and that's all that's to it. And in 2014, the health accord that was put in place in 2004 expires. And Harper is trying to find a way to get out of that accord and out of that responsibility. Your role is to fight him, not to adjust to it, not to cut back on services in PEI because of Harper, but to look him in the eye and say it's unacceptable. And I hope you will do that, because it's very, very important for health. And remember, the way things are going, 2 years from now, Mr. Harper may not be there. So why would you make these changes now when you don't know what the situation is going to be in 2 years? It takes longer term. So those are the main things, but in Ontario, what the health coalitions are calling for is a moratorium on all these changes until more research is done, because they are finding that the costs are more, the results are not better, the people are disenfranchised, and so on. And there are unintended consequences of those changes. So it's not as if people don't want to change. I think people are progressive, they will change. But they know that there can be unintended consequences, and these have not been studied. So please listen to the people.
I'll just respond to a few of the comments there, and if I miss some, just let me know. But from Health PEI's point of view, we do actually have a number of surveys that are done by various services, whether it be public health or emergency rooms or primary health care clinics that are sent out on a regular basis to see how our services are going and what services need to be done in communities. We've also had focus groups back in January and February in a number of communities across PEI around services that are available and changes that are needed in the healthcare system. We did a primary healthcare survey about a year ago as well that went out to 60,000 households as well around primary care services. And of course, Health PI has its annual general meeting that is held in the fall each year that we report back to the public as well. In terms of the transfers that occur, I just want to reiterate to everybody that not everybody who has surgery in Charlottetown or Summerside are going to be transferred out for their post-op care. The usual post-op care is still going to continue in Charlottetown and Summerside. It's the prolonged post-op care kind of thing that's going to be transferred to various places, and that's actually very few of the actual number of let's say operations or strokes and that kind of thing that do occur. So it's not everybody. We're talking about 1 or 2 people a day that'll be transferred. And there are, of course, some that are being transferred now. The other question is around the emergency rooms. We currently have 4 emergency rooms in the province, and we still have 4 under the new plan. So there isn't actually any change to emergency room services that's scheduled. Okay? But I may have missed a few of your questions, but unless the minister wants to respond. Yeah.
Thank you, Dr. Wedge, and thank you very much for your question. Your statement was very much appreciative. I was actually familiar on the ambulance side with that study. We do own and operate 2 services in Ontario. One of the big major differences that I just kind of wanted to point out to some of the members of the public is within rural Ontario, there aren't a lot of advanced care paramedics. In fact, most of the services aren't at that level. They're at primary care level. So there definitely is a gap in the provision of treatment which those paramedics can deliver, especially with prolonged response times. So I just kind of wanted to let some of the members know for their own personal benefit that here within Prince Edward Island with the advanced care paramedic level and the high level of trained paramedicine that we do deliver, we're very confident that we are going to be able to deliver a lot of the skills and treatment that are needed. Obviously, we cannot replace the nursing and physician staff within those communities, but through our collaboration with online medical control and constant contact, we're able to provide that type of service. Thank you.
Just to clarify, even the critical care, the highest trained paramedics in Ontario said they couldn't do it either.
Yeah, just to follow up, Mary, your question regarding publicly funded Medicare, and certainly we've had lots of good conversations, you and I, about that. Obviously, a year ago, the discussion was on the table nationally about the 2014 Health Accord. And that was a renewed focus for the next 5 to 10 years about building a stronger partnership with the federal government and the provinces and the territories in this country. As the health minister here in the province, I was very optimistic about that partnership with the federal government. Obviously, the 2004 the 10-year accord that was initiated, I believe, by Paul Martin's government at the time, was implemented and was coming to an end at 2014. We basically had a very proactive discussion. The provinces and the territories were lobbying the federal government very hard. And I felt at that meeting, which would have been early November, that we were making some progress, and we got some reassurances from the Leona Glucock, the federal Minister of Health in the country, that we would continue to collaborate and work together. 2 weeks later, the Minister of Finance for the federal government presented a transfer payment and ended the 2014 Health Accord at that point in time. So I want to reassure that I'm very much advocating nationally for the protection of publicly funded Medicare in this country. But it's very difficult when you have a federal government who wouldn't even allow the opportunity to have that discussion. So it is very difficult, and I must admit that. In reference to my comments, I don't want to spend all my time and energy. I mean, it's difficult trying to have meetings and create plans and visions and look at investments when you can't have the ability to have a meeting or discussion. So it is a challenge, there's no question, but all we can do is continue to lobby and to work with other provinces and territories. The challenges that we're facing here in PEI are no different than any other province in this country. So I see some tremendous opportunities federally in the whole execution and delivery of healthcare. So I don't know what's going to happen in the federal landscape, but hopefully there will be a change of mindset in respect to the delivery of healthcare. It's a big issue. It's one of the biggest issues in the minds of Canadians. Thank you.
Further with the questions, I just want to check in here for a minute. And I'm looking at the line, and I recognize some faces who are not from the Montague area, and I do want to make sure that if there are folks in the audience from the Montague area who have questions, and I don't know who you are, that I want to make sure that you do have an opportunity to make those comments first. So, I understand that, Alan. And so, I do want to make sure that the people who live here have an opportunity. I know one lady was standing for a very long time over there, and I hope she's okay there. So, thank you.
Colin Levy, MLA, Surrey-Mire. My questions are directed to Matt. Matt, do you have any spare ambulances as of today?
Within our system, sir?
Yes.
Yes, we do.
You have spare ones?
Yep.
Okay. Second question, you mentioned earlier your transfer service to Surrey, Montague, Alberton, Tignish.
Yes.
You never mentioned any of the urban areas. When your stats come out,
Yeah.
it's right across the island.
It is, yeah.
Do you have stats for urban and rural separately?
We do.
You do?
Yep.
How come them rural ones ain't publicized?
We do actually, internally, we do a provincial, rural, and urban within the communities of, let's say, Surrey, Montague, Alberton, O'Leary. They are rural, so there is no separation between urban and rural. In order to do that, we would have to have what's called a computer automated dispatching system. We are looking at that, and we've actually looked at a couple of different vendors, but our current technology doesn't have that capability to separate those locations.
Okay, what's your stats?
Our stats are actually on our website. So you can go on our website and see the
30
last
minutes or
couple
less,
of years.
90% of the time?
Pardon?
30 minutes or less, 90% of the time?
Yes, I'm not 100% sure what the stats were last year, but
Do you realize there's 15, 20, 25 minutes east of Surrey yet?
yes.
You realize
Yeah,
that?
it includes all of that community. So when you see the Surrey stats, it's all of that community. So what it means is all of the communities right straight to Montague boundary are included within the Surrey stats. So we're not excluding any. What would be the difference is if we were able to urbanize Surrey, that would be just the town. Our stats would be very good, obviously, but those outer communities factored in make our stats a little bit longer.
Another thing you mentioned when Montague ambulance is out of the area, one was pulled in from Charlottetown.
Yep.
Are you sure it's not pulled in from Surrey and Surrey's left with no ambulance?
What we do is we have what's called a provincial system status plan. We have a number of units across the island, and based on the call volume and the amount of units that are available, we post location or units within those locations. So the only time there isn't a unit within the Surrey area is when we're down to 2 units in the east. So there's one in Montague and one in Charlottetown. Other than that, there is one within the community. And with a rapid response, we're going to be able to fill that hole, and there'll be one in Surrey, one in Montague, and one in Charlottetown.
So what happens if there's only one ambulance east of Hunter River?
If there's only one ambulance east of Hunter River, it's posted at UNB or Stratford, and it's mobile. So we're trying to clear up units as fast as we can, but in that state, we're an emergency.
Has that ever happened?
To my recollection, it's happened once in the 2 years that I've been here, and it was that way for approximately 4 minutes. And we do additionally staff units. So when you think about it, we have our units within our system. So we have 14 ambulances across the island throughout the day that are available without these additions. We do 15,000 calls a year, or 14,005. When we have a large collision or a multiple incident involving multiple casualties, unfortunately, we have to deplete our resources to respond to those emergencies. We do everything we can by staffing additional resources, so we'll actually call in additional paramedics, but as you can imagine, when an incident like that happens very quickly, it takes a few minutes to get paramedics into our locations and staffed up, but we do try and upstaff as much as possible for those locations. Any large events such as Cavendish Beach Music Festival or large areas will upstaff units within the area, but we're thinking really positively about these rapid response units and the ability that they have to clear up very quickly that is going to improve our response times in all the communities and specifically Surrey.
You had one ambulance east of Hunter River longer than 4 minutes, and it was in Surrey, and you didn't have the staff to staff it. Medical first responder myself.
Yep.
Work in the system, see the system, and don't believe in the system.
I'm sorry you feel that way, sir. I mean, we really try and provide a quality service to the communities. As you can imagine, it's a 24-hour, 365 days a year service, and we do have unexpected emergencies. Unfortunately, no company can staff to have an ambulance in every street corner at every time when a call can happen. I will admit these new additions are going to improve Surrey specifically. Surrey, when with the low call volume within Surrey, unfortunately, when a high majority of calls happen, sometimes we don't always have a unit available at that particular second.
Your fast response vehicles, are they 24/7?
No, they're through our daytime hours, 9 hours a day, through our peak times. So they're going to be adjusted based on the communities for that call volume. So within the east, the time of day start time could be different than the west because of the majority of when the calls happen.
So everything, all your stats are in the past and nothing looking into the future. Nobody gets sick after hours.
Absolutely, sir. And we do have units within our nighttime. We look at our stats 24 hours a day, 365 days a year. The majority of our calls, which we're not meeting our response times, are through the daytime hours. It's not at nighttime. Through the nighttime, we do have a good resource of additional resources within our system. It's through our daytime, which is probably 70% of our call volume. So that's when we needed these additional resources.
One more question. I won't hold anybody up. To the Minister or Dr. Wedge. Is the crash unit leaving Surrey Hospital?
What do you mean by the crash?
It's the crash unit when somebody's in cardiac arrest?
The actual tray that they use for medications?
Crash cart?
No.
It's not leaving?
No.
Thank you.
The nurses are already trained to use it now, and obviously these people are in hospital because they're sick, right? Yep.
Hello, thank you for coming. I'm afraid this is an ambulance question too, sir. I'm Bertha McLean from Montague.
Yes, ma'am.
An elderly lady in the complex where I live phoned me early one morning. She said, will you come down? I'm afraid I'm having a stroke.
Sure.
And I said, oh, I don't think so. I assured her, I think you would have slurred speech would be part of it.
Mm-hmm.
I was able to take her blood pressure. It wasn't relatively high. So she said, will you phone my son? And I said, yes. So I phoned him. And when he came, he phoned an ambulance.
Yeah.
On arrival, sorry, thank you. On arrival, they said, take my mother to the QEH. He said, oh, I'm sorry, I can't do that. I'm not allowed to go outside of Montague unless she was a patient in the Kings County Memorial Hospital.
Okay.
Why would that be?
If the facility was open at the time, generally we go to the closest facility that can deliver that type of care. So if it was through daytime hours when there was a physician on site, then that patient would go there for care first. I'm not sure the time frame, ma'am. Was it recently? Or?
Yes, it was Saturday morning at about 6:30, 7 a.m.
Yep.
And she spent 2 nights on a cot in the ER observation room. And then this morning she got a nice appointment, early appointment at noon at the QEH in town.
Okay.
But I was told it was only going to be 1 ambulance available in Montague. Is that true?
No, there's actually 3 within this area.
Okay. Well, I guess that's it. Thank you very much.
Thank you very much. Do you want me to stay here? Or?
He's on to me. No, you're good. Good, Matt. Minister and Doctor, my name is Gerard Holland. I'm a paramedic. I'm the former owner of Kings County EMS, and I'm a employee of Island EMS also. And I just taken off, obviously, the Island EMS hat, put on the former owner hat. And I just want to say to clarify a couple of things. Matt here is this evening, and I'm feeling bad for him because he's getting drug up on the mat here. But Island EMS is a really good ambulance service, period. That having been said, they can't wave the magic wand and make trucks appear and disappear. And I think that the primary problem with the EMS service, especially in Kings County, and I also believe it to be a problem in West Prince too, is that there is not enough funding for enough trucks in the system. I mean, when you go to government, and I can't put words in Matt's mouth here, obviously, but can you not see Island EMS going to government and saying, we need 17 trucks to make the system work properly? And the government's coming back and saying, we don't get 17 trucks, you get 15 trucks, you got to make do from within. And EMS services do not work well when those types of things happen. Anyway, that having been said, as I said, the medics in Island EMS are great medics. We have a lot of advanced care paramedics, intermediate care paramedics. They work hard, they work long hours, they're on the go all the time. Their managers work hard. Matt works hard. It's a good system. It just needs the proper amount of funding. Minister, I just want to bring to your attention, since the meeting in Surrey, which was about 2.5 weeks ago, we've had 3 extended EMS response times in the Surrey area. So Surrey a couple of years ago, 5 or 6 years ago, gave up their emergency room department, and the trade-off was to be, okay, you lose your emergency department, but you get a bump up in your EMS service. Well, it's been bumped down. And they suffer the effects, and it's a trickle effect back to Charlottetown. It's also my opinion that Kings County, or in the Montague area, has had poorer response times. And it's not an Island EMS problem. It's a funding problem. At any rate, going back to the 3, and this is not an isolated incident. I believe that this is happening in Surrey on a very regular basis. But on April 11th, we had a shortness of breath in Little Pond. Response from an EMS unit was from Montague, not from Surrey. April 12th, we had a broken arm with a possible head injury in Surrey. The response was from Montague. April 15th, or approximately April 15th, I'm not 100% on the date, we had a CVA, which is a stroke in Surrey, and the response was in the vicinity of 45 minutes. I'm not sure if it came from Montague or Charlottetown, but it was an extended response time. I would challenge you, Minister, to look back in the Surrey EMS response times over the last year, and let's find out what we're actually talking about. I think there's a great deal of calls, people getting left behind in the Surrey area, and that affects this area too, because a lot of times the EMS vehicle is coming from Montague.
Thanks, George, for your questions. Obviously, I can't get into, the clinical calls and assessments and so on. I do know that in 2006, there was by the government of the day, a renewed focus in how ground ambulances would be provided here in the province, and I believe you were one of the former owners. Certainly, I'm not going to go through, but there's been a number of system enhancements since 06 till today, and obviously we're continuing to evaluate and looking at investments in. Obviously, in 2006, there was a 10-year contract signed by the government of the day. I, as minister, am aware of that contract. I basically did not renew a 10-year contract with Island EMS, and Matt is certainly well aware of this conversation. The Auditor General is currently has done a review of that contract. There's currently a work plan in place at Health PEI where a number of recommendations have been made. I know that Health PEI and Island EMS are working towards responding to those issues. But certainly as Minister, I'm very, very committed to looking at ways that we can continue to build our ground ambulance fleet. I feel that it's a tremendous asset and a tremendous service here. And the investments have continued to grow since 06, and we'll continue to look at the contract and look at that service. It is a substantial contract, but certainly not extending and going into any long-term contract with Medivh until we feel that we're continuing to respond to some of these issues and questions that we do get from time to time. But with that being said, I've got great confidence in Island EMS and the ground ambulance fleet here in this province.
Minister, I'm sorry, but I think you're appreciating the problem, and that you're basically dealing on the fact that you haven't renewed the contract of Island EMS. Island EMS is not the problem here. And I want everybody to understand that from me. The problem is that they're not getting enough funding for enough trucks to service the area. Matt can't defend that in the sense that he's only been here for 2 years. He doesn't know what the provincial expectations are. Yeah, I know. At any rate, we'll leave it at that. I have, on behalf of the family of one of the calls that I am just referring to here, the family asked me to read this letter. Dear Mr. Curry, and I'll use the family has asked me for the media to respect the fact that they want to have their letter respected in confidence to the minister, so I'll just use a John Doe name. Dear Mr. Curry, my name is John Doe. I am 9 years old. I had trouble breathing one night a few weeks ago. My parents had to call 911 for me. The fire department came first to help me, and it took a really long time for the ambulance to get there. I live in Little Pond. Mr. Curry, I have gone by ambulance more than once in the last few years, but this time it really scares me because it took so long. Mr. Curry, could you please help me so that it doesn't happen again? I'll ask you to respond to that. So, Minister, I guess we're here again tonight, 2.5 weeks after we were in Surrey, and the question is still looming. What are we doing to fix the EMS response times in Kings County? What are we doing today for that?
Well, Matt, obviously, Gerard, obviously the investment that obviously we've made here with the response vehicles is obviously a step forward. Obviously,
I agree.
Yeah, okay.
I just wanted to hear it.
So obviously, we've been into this for 2.5 weeks. Obviously, I am in constant conversation with George McCullum, the owner of Island EMS, and Matt, constantly looking at ways that we continue to be an effective, efficient service. Obviously, as the minister, I have to look at healthcare equity from tip to tip, whether it's in Stanley Bridge or Surrey or Tignish. And certainly, if you look at the investments have been made, there's been positive steps forward, but obviously more work needs to be done. And certainly government recognizes that. And obviously these informations and these questions are continuing conversations about ways that we can do that. I'm hearing from communities. This is the 6th public meeting, so we'll look forward to continuing to improve the system and to be the best system that we possibly can be. Thank you.
Great, thank you. Just want to switch over to the hospital issue, Minister. As you know, the status of the emergency rooms in Kings County is that we have an emergency room in Surrey that is completely closed, and we have an emergency room in Montague that is only partially open. So, Minister, obviously, first and foremost, we'd like to have docs staff our emergency departments with a complement of nurses and whatever the case may be. But in lieu of doctors, would you, Minister, consider putting a nurse practitioner and or a nurse and or a paramedic in the emergency room in both the Surrey and the Montague emergency departments when doctors are not present there?
Just in respect to the emergency situation here in Montague, obviously I think it's fairly common knowledge that the physicians collaboratively made a choice that they wanted to spend more time, obviously, in their clinics and working the shifts, obviously, during the day. That was a decision that was made. I, as the minister, in the same situation we're dealing with in the Western Hospital, which is very similar to emergency rooms across the province. I mean, here in this community, we've expanded access to family physicians by approximately 6,500 appointment times as a result of the physicians not working in the evening. Keeping in mind, during that decision, obviously, there was low volume and low acuity that was coming in. Obviously, we are currently implementing the CEC model, which has been very, very successful in the province of Nova Scotia in jurisdictions and towns equivalent to the size of Montague and Western and Surrey and so on. So obviously our focus is on implementation to evaluate that, but certainly always very open to look at new ways that we can continue to meet the demands that are placed on the system. So,
is that a yes?
I can't make a commitment on that.
I just asked for a yes, a no, or a maybe.
Basically, I am...
what I'll do is I'll repeat the question.
No, you
Minister,
don't need to
you did your posturing. I'm going to do mine now.
Okay.
Respectfully.
So
Minister,
right now, my answer is no at this point in time.
Oh, boy.
Quite a few questions there,
No, I don't have any left. That's
okay.
the one I wanted to answer.
And I'm just looking at the others.
To put in perspective, I guess, Minister, some of the fire departments, as Colin alluded to, are doing 3 first responder calls in their communities in the run of a week, whereas Charlottetown doesn't do first responder calls. Not to create a scenario of Charlottetown versus Kings County or Charlottetown versus Montague or Surrey, but that in itself tells its tale. I mean, we need more EMS trucks, and I would think you would be quite wise to renew your relationship with Island EMS. They're a good company. I believe in them, but the funding is not there, and that's where we're falling down here. Thank you.
Well put, Gerard. My name is Sandra Gordon. I'm from Mary Harbour. I'm a retired RN from the ER department at Kings County Memorial Hospital. I'm going to start off. I have a few questions regarding the ambulance service, and this is just popped up while watching the slideshow, I thought I saw on there that you have 19 units.
Yes, in total in our
Okay.
system.
Pardon?
Yes, in total in our system, including our spare units.
Okay, 19 units, and you say there's 3 categories.
Yes.
Okay, how many of those are allotted to emergency care, emergency calls?
All of them.
All of them,
Yeah.
okay. Looking at the map that you had up there,
Yeah.
in West Prince, there were 5 little stars.
Yeah.
And then, I guess, Summerside, I don't know where all, and Charlottetown. In Kings County, there were 3 stars.
Yeah.
1 Surrey, 1 Mount Stewart, and 1 Montague.
Yeah.
How come we don't have 5 stars?
All-
Why don't Vernon River and Mary Harbor
Yeah.
have an ambulance situated in those communities?
All it is, ma'am, just to give you a little bit of background, is the map shows all of our bases. So we have six stations across the province, 1 in Montague, 1 in Surrey, 1 in Charlottetown, 1 in Summerside, 1 in Alberton, 1 in O'Leary. The other locations that are on the map are posting sites, and they're not necessarily all filled at the same time. What it is we look at our call volume. So we look at where calls take place within a region in a run of a 24-hour period. And as units become depleted on calls, they get stationed at those posting sites. So even though the western end of the province, let's say, had 3 or 5, they all wouldn't be filled. If we were down, let's say, from 5 units to 4, then they may be moved to a certain location. And when you're down to 3, they would be moved. So we use different ones at different times. So one of them, which you might have seen centrally, was New Glasgow for Cavendish Beach and things like that. That would be utilized during high volume areas, but necessarily wouldn't be posted all the time.
But West Prince are allotted 5. Why isn't Kings County? And West Prince is in Prince County. There's east and west. Why doesn't Kings County have allotted 5
We could put
in different areas?
We could put locations in different areas, but it's still the same coverage area. So what I mean by that is we could put 2 additional posting sites
Well,
here.
put them there. Really? My other question was answered. Some gentleman asked the response time, which you said 90%, but I did want to break down the urban and rural.
Yeah.
But you did tell me if I go to that website,
Yeah.
I can see the times that are there.
You can, and just to reiterate, because I didn't, Mr. Levy, I didn't mean to confuse him at all, but when you look at our stats, let's say for Surrey, they're inclusive of every community on the outskirts of Surrey. It's not just Surrey, it's every community. If we broke it down from urban and rural, our urban stats would obviously be a lot better, but we take all of our stats right to the tip of the island and include it into Surrey. So that's why they may look a little longer.
I just feel sorry for Kings County. We're a have-not province, and we're losing out on good ambulance service. Not the service that you get when you arrive, but when you call for an ambulance and the response.
Mm-hmm.
Because you're pulling, as you say, Montague at one time can have 1 ambulance to cover all of that area.
Yeah.
And if it's called to Mary Harbor, where I live, and then they get a call from Surrey,
Yep.
they have to wait.
That's why this rapid response unit, as Minister Curry spoke about before, is really going to be a benefit into the system because it's going to clear up for available calls. So we're going to have a unit which is available in the system to respond to emergencies.
So you're getting another unit, rapid response unit.
We are.
3 of them, 1 for each province,
We're
1
getting-
for each county.
We're getting 2 rapid response, 1 east, 1 west, and a patient transfer unit. And the patient transfer unit is going to be able
When you're
to
saying east, are you saying Kings County?
Yes.
Or
yeah.
you're saying from Charlottetown east?
No, we're
and
saying-
from Charlottetown west?
We're saying Montague, Surrey area.
Okay, thank you. Now, that's all about
Okay,
ambulances.
thank you.
And this was touched on by Gerard. And it's about your collaborative emergency care system. which you're going to put in Alberta. Well, why the hell didn't you put it in Montague when you closed our ER overnight? You promised us once we got the staff in, once we got the lab x-ray staff,
Yes, you're
it'd
right.
be open. But you bowed to the physicians because they didn't want to get out of their friggin' bed at night. And I know that.
I know. Anyways, thank you. Obviously, the CEC model is something that is relatively new. Obviously, in the last probably 8 to 12 months, they've been implemented in areas like Spring Hill and Tatamagouche and so on. So
I've
it's
read
relatively
about
new.
it online.
Certainly, I am very focused on a very effective transition for the CEC. I think it has huge potential, not only for the community of Alberton and the region in the West, but hopefully with positive implementation. We're still working through with unions and so on. Hopefully we'll see more CECs throughout the province as well. Thank you.
Well, since we were the first ER that closed overnight, why didn't we get the pilot project? Why? Tell me why. Why is Alberton getting it and not us? Don't you think we deserve it?
I guess the only difference I can identify is that there was still a number of physicians in the West that were trying to hang on to the service overnight. That
Are
was
you
a little
telling
bit
me
different.
that the 7 physicians in Montague, every one of them was dead against it?
I can't.
I can name 2, 3 at least. I know that we're dead against it, but I'm sure a few of the others would have bowed out and said they'd cover. My God, they're only on call one day a week. There's 7 of them.
I don't want to speak to
No,
the
but I
group of
think we
physicians,
should
yeah.
have the pilot project. I'm
Yeah.
sorry, but I
Well,
think we
certainly,
should have it.
obviously, as the minister, and I'll commit to the community night, that is, we want to focus on implementation in the West, and I'm optimistic with a positive implementation that we'll see more CECs throughout the province.
Do two, and see which one works the best. I bet ours would. Thank you.
Madam Chair, Minister Curry, other ministers, your panel, mayors and fellow councillors, and most importantly, the residents and taxpayers are in this room here tonight. My name is John McFarlane, and I am a councillor for the town of Montague. I'm also, I work in the healthcare field. I work at a drugstore in Montague here. I'm also a volunteer member of the volunteer fire department. I am not speaking on behalf of my work. I am not speaking on behalf of the department here. I am speaking on behalf of the residents of the town. Recently, we have been informed of a devastating news that a local lobster and fishing processing plant that is out here in Broadnill, but very close to the town, will not be reopening. Mariner Seafoods, you're aware of it. This is a loss of approximately 200 jobs, and we're all aware of the closing of the Federal Election Center as well, in Broadnill, and the the Addiction Center in Montague, and the Canada Services Center in Broadnill as well. That'll be some 60 federal jobs. Quite an economic travesty for the town and surrounding area. Minister Curry, my question to you tonight, please tell us tonight that there will be no job losses nor any more service cuts to the Kings County Memorial Hospital and residents of Kings County due to the changes that you are proposing here tonight.
No, the answer to that is no, and I think the mayor beat you to that question. I don't know if you were here or not.
No, it was a little bit different than his question, but okay.
The answer is no.
Great, thank you. I guess this one will be directed to Matt. You're going to lose weight tonight, buddy.
No, that's okay. That's why I'm here.
How many ambulances are currently stationed and accessible to Charlottetown, to the Charlottetown area?
Within the Charlottetown area through the day, there's 3 units.
Just 3 units?
Yeah.
Now, accessible means they can be drawn from Kings County, they can be drawn from Prince County.
That would be true for any community.
Okay.
So Any community can draw from. We utilize all of our units. So if Alberton depleted the system, we would send units from Charlottetown to Alberton.
And how many are stationed? I'm not going to say accessible. I'm going to say stationed in the Kings County area.
3 in Montague and 1 up in Surrey.
There are 3 ambulances in Montague at all times.
Not at all times within the system. So they start their day within Montague. We have 3 units out of the Montague base, but due to transfers and things like that, obviously some of those resources are utilized.
And you have 19 units right across the island. Not all 19 are in use.
That's true.
Okay. Don't see too many of them down this way. The town of Montague is a service center for 15,000 people. We have 1,800, a little over 1,800 residents in the town. We are looking for more service here. You've heard it before. I'm going to reiterate it again here tonight. Another question that you mentioned earlier, that the ambulances, if they land at, let's say, East Baltic.
Yeah.
Let's say they land at Pamir Island, which is my district. They can, the P3s or the advanced care technicians, they can attach an ECG, a 12-lead ECG.
Yep.
But in the case of a stroke or a case of a heart attack, they cannot or they can administer the antithrombolytic medications.
Not yet, but we're very close to it. So there were a couple of missing pieces. Over the last year, actually, we implemented one of the procedures. It's called a reperfusion checklist about a year ago in preparation for thrombolytics. We have the training already developed in-house. One of the big components which we were missing was the ECG transmission. So before we can actually administer thrombolytics, we need to confirm that it is a suitable case for thrombolytics. Right. We're just implementing the 12-lead ECG transmission now. So we're hoping within the next coming months to the year that we will move towards thrombolytics.
So they can only be administered at Queenie or PCH?
At the nighttime, yes. Yeah. I believe Montague as well through the daytime when the physicians can administer thrombolytics.
Okay. Thank you very much.
Thank you.
Hi. I don't want to there. My name is Peggy McLeod. I'm also a town councillor, as well as a retired nurse for the past year. I was just watching as you put the things on. I was quite upset when I came here, but then you took the wind out of my sails. So when you said that Kings County would remain open, but I don't really feel that all the facts that you presented are right. For example, response time. When I worked in the ER, response time of the ambulance, we called them one day to take a lady to Surrey. When they came and got her, it was 24 hours later. That's not a very good response time. I also feel that when you were showing that there's maybe a patient taken up the inpatient overnight, there could be as many as 6 patients. Six emergency patients taken up to the floor for the night and dragged back down in the morning with only 2 people to do it. What?
Sometimes only one person.
Sometimes only one person take them. No, there's 2 now. The board clerk helps. But that's not really my question. My question is, you have assured us that Montague Kings County Memorial is going to be open this year. There's no changes. I would like to bring up the doctors again, being the deciding factor in that we're not open 24/7 in the emergency department, because I know for one, I don't want to go to Charlottetown, Queenie, in the middle of the night, and I'm sure there's a lot more here. And I certainly don't understand why Surrey is closed to acute care. I think that is, like if you have an 80-year-old woman and her 85-year-old husband is in Montague or Charlottetown, and she doesn't drive, how's she going to see him? Say he's at the QEH and he had a hip repair. She doesn't drive. How many times is she going to get somebody to be able to take her in to the QEH? It's just not right for you to close acute care in Surrey. Okay, if you'd like to speak.
Well, when you're done, or do you want me to do now?
No, I'm not done, actually. I just don't believe what the government is doing to the health care is right. Certainly, I don't believe in closing acute care beds in any hospital. I don't believe, and I'm going to once again address Minister Curry. Now, you've been asked this twice, and I don't feel that we actually got a proper answer. The thing is Montague, there's no changes to Kings County Memorial this year, but what about next year, and what about in 5 years' time? Could you respond to that, please?
No, there's no plan or agenda by government to close the facility here in this community. Basically, the whole mandate of this exercise moving forward is to utilize, there hasn't been a bed closed in this province with this exercise. It's about using our facilities to their full potential and capacities. And I have numerous conversations with people that live in Charlottetown and basically say, if people can drive in. I was at the QEH last night. I spoke to 2 people from West Prince, 3 people from Kings County who are all getting services and who are very happy with the care at the Queen Elizabeth Hospital and will be eventually transported out or be sent home. The agenda here is to look at using all our facilities to their full potential and full capacity. That's it.
Okay, could you?
Asked about closure. She asked about changes.
No. Answer's no.
So Kings County will continue to be an acute care hospital in the foreseeable future?
Yes.
Thank you.
Yes.
Watch her, Doug. Watch her, boy.
Hello, I'm Doreen Glant. I'm from Surrey, and Montague Hospital is our ER, so I have a right to be here, so please don't kick me out. Anyway, this government's healthcare advisor, this government and their healthcare advisors are using a report done by Corpus Sanchez in 2008 to curb spending for PEI health. I took the time to review it and found some flaws in this report that need to be addressed. One in particular can be found on page 15 of the report. There is a chart on this page that breaks down spending in health. I don't have your PowerPoint program that I can address, but I will address this. With my notes. 44% of hospitals is what's spent in healthcare. 44%. Which is equivalent to $251 million. 5 rural hospitals is $21 million. 3% of mental health is $17 million. 14% manors and private nursing homes, which is $80 million. 3% home care, which is 17 million. 2% public health, which is 11.4. 2% community-based health care and health centers is 11.4 million. This equates to 68% of the total budget, what I just presented there. Now, there's 32% of the total budget that's not accounted for in dollars. This means $183 million, which means, to me, which leads me to believe this government has something hidden, and also shows how poorly this report is written. Even I know that you don't do a report and leave out 30% in your charts. 32%. Taking a quote from a local newspaper, Paul McNeil's, on April 24th, on the graphic, which was a very good report. I hope everybody read it. The C.D. Howe Institute, which is a right-wing think tank, recently produced research showing administrative costs for PEI healthcare system at 3.5 systems are 3.5 times the national average. Now you say we, as a province, have the same problems as every other province. Well, listen, 3.5% is ours, and we are 3.5% times the national average, okay? So maybe that's where we should start looking first, not the rural hospitals. Rural hospitals aren't the problem with the healthcare. I really strongly think administrative costs are astronomical. Start looking at them. Premier Giz said something about silos. I think he's talking to the Saskatchewan Premier a lot when he's talking silos. But anyway, to me, the definition of silo is storage unit, okay? So I'm just pointing out that this 32% might be the silo. Take this storage unit out of the government. It's waste. I'm not saying 32% of it is waste, but I'm certainly hoping that rural hospitals aren't going to be the ones that take the knock. Administration should.
Certainly I agree that the rural hospitals are not the cause of the problem. You're correct. It's about $22 million, but around $81 million is spent on programs and services in rural Prince Edward Island in that thing. So I'll have to have a look at that chart again to kind of see what the part's missing on there. But yeah, I've read it several times, including back in February. Yeah.
Good evening. My name is Jim Bagnall, and panel, welcome here tonight. Thank you for taking your time to come out and discuss healthcare in rural PEI. My first question tonight was going to be, is there any changes going to be taking place to the Montague Hospital? Well, obviously that's been answered 3 times, so that's fine. But the word that I kept hearing was scheduled. There's nothing scheduled at this time. And Dr. Wedge, you related to that 3 times tonight in your talking, that there's no changes scheduled at this time. And I guess that's my concern is, are you trying to do the other hospitals first and then come on to Montague after? That would be my first question. My second question would be to Matt. He talks about having 19, but I understand there's only 14 that are operational at one time. Is that correct?
Yes, it is, sir. When I say 14, there's 15. One would be a supervisory vehicle, which is a support unit. We do have a couple of additional units, and that's for preventive maintenance. So as you can imagine with our units, our garage maintenance our vehicles. So that's why there's a couple of spares. Otherwise, we wouldn't have the ability to keep them regularly maintained.
I think what you forgot to mention, though, to everyone is that come nighttime, you don't have 14 ambulances on PEI.
No, that's right.
You've cut them back to 8
Nope. 9. Yep.
9 ambulances.
Yep.
Why would you cut them back when you've cut out the emergency rooms at night, when that's when we're going to need emergency services, and you turn around and say that because we're cutting it out, we're putting more ambulances in, but at nighttime, you don't have them on staff, you don't have the staff, and you don't have the people on to handle it. So you've only got 9 on. You're closing down emergency room in Montague. You've closed Surrey. We have got maybe 1 ambulance on for both of us at nighttime. And you're saying that we've got good service.
I apologize, sir, if the service isn't meeting your expectation. Obviously, that's not our goal as a service. When I say that we have, 9 at night, we have 2 other additional units that work up, one until 10 p.m. and one until 11. We stagger our start times of all of our vehicles starting at 5:30 in the morning right up until 11 p.m. So, and why we do that is that's the majority of when our calls take place. So the majority of our calls all happen before midnight. within after midnight in each of the communities. Every community is equipped with an ambulance, including Surrey. And we do have a couple additional ones within the communities that we can rotate through if one of them goes out on a call. So obviously, I'll admit it's not a perfect service, but we are looking to try and maximize our resources and provide good response times. And I think if you look at our response times and compare them to the other provinces, taking into account that all of our calls are on there and the other provinces will have their exceptions out, we are actually trying to provide good response times. But I admit, on a perfect day, we would be there within a matter of a couple minutes on every call.
And I get, thank you.
Thank you.
That's all I have. I guess with our hospital, I am very skeptical on their comments, and I guess, and probably I'll say why. When Surrey was closing their ER, you said Montague was not going to be a problem because we're expanding the CR. We're doing a big remodel. We're going to be able to handle it. Montague Service is going to do all the ER for Kings County, 24-hour service. I'm in the legislature one day, and the minister asked me to come in back. He wants to talk to me for a minute. So we go in back, and the conversation was that, Jim, we're going to have to close the Montague ER for 28 days until we put some people in place. Now, he looks at me pretty, and he said, I said, well, okay, if I've got your word. And the minister said yes. He shook my hand. He said, I'll guarantee you, in 28 days, the emergency room in Montague will be open. Well, that's 4 years ago. And it hasn't opened. We still are closed at 10 o'clock at night. So I'm hearing tonight that no, we're not going to touch Montague Hospital because it's not scheduled at the present time. I'm skeptical. It's not scheduled. Does that mean that in 6 months' time you're going to change the schedule? In a year's time you're going to change it? Or 2 years' time you're going to change it again? Because you don't want the upgrade of the whole province going up because you're doing all the changes at one time?
The only thing I can tell you is I'm not aware of any changes scheduled for the Montague Hospital in the future.
There again, you've said it again. Schedule.
But again, I'm not aware of any changes that are planned, in the works, scheduled, whatever word you want to use. I am not aware of any changes.
Except for when you're going to do the pilot project.
And I guess I understand there's restraints on government. And I understand there has to be changes to health care. I'm not naive to think that can't happen. But when you look at the costs for rural hospitals across PEI, it's a very, very small percentage. And we had good care in the rural areas. Mm-hmm. We're losing that. And we're losing our identity in rural PEI. We're losing our identity not just in Montague, not just in Surrey, where the two hospitals are, but all the outlying communities also. Because in order to have a vibrant community, you have to have certain identities in the community. You have to have churches, schools, hospital, for people to settle and to be comfortable settling in the area. When you start taking away the services like you have in Surrey, people become uncomfortable. They don't know whether that's where they want to set up roots anymore. If they're going to retire, older people, the older generation, are going to look where they can get emergency service in emergency area. And to me, all we're doing here is drawing people out of Kings County and taking them to the urban area. And you can put all your numbers and facts together, but if you don't look after a rural PEI, I tell you, it's going to dwindle. your tax base is going to go down, and you're going to be in an awful lot bigger problems than you are today with things, because most of our income is coming from transfer payments and we're a have-not province. But right now, there's more have-not provinces across Canada coming on stream all the time. And that means that we're going to get a smaller slice of the pie than we used to get. And when you are losing your tax base across the province, you're going to be in real major problems. And all the changes you're making here are not going to help as far as rural PEI is concerned. And I think you've made a fundamental change, and it's wrong. It seems like this healthcare and this government wants to move everything to the urban PEI and forget about rural PEI. Well, we're not to be forgot about, and we have to continue. So I have a second.
I think Mr. Bagnall plans to run again. My name is Edith Perry. I live in Millview, which is in the Vernon River area, and Montague is my area. My husband and I prefer to do most of our needs in Montague, simply because we are rural people and we identify with rural people. And you know, I've had to have physiotherapy, etc., following hip surgery. I much prefer to come to Montague and use the services. We don't have to pay for parking. It's god-awful when you go to Charlottetown. You have to walk miles even from the special permit laws. That being said, I want to address a couple of issues. Regarding home care, not very much being said in any of these presentations and any of the reading material. I know there's talk about expanding home care, but if you want to keep us older folk fairly comfortable and at home rather than in a long-term care, et cetera, I think you really need to get right into the home care services. And that means we need more nurses. We need nurses visiting, and notice I'm saying not doctors, nurses, coming into the homes. We need people who do foot care that we don't have to pay for. Right now, I pay for my foot care. There are so many things that those of us who would do better by staying at home need as services. And I guess that brings me to not just us older folk. There are many other younger people who would do much better if they were at home and be given the kind of services they need. There are many people with disabilities and challenges. And that brings me to my concern about, and I think it's been raised, how in the world do we afford on fixed incomes as seniors and as low-income people to pay for these extra needs, which includes ambulance services? I think it's, $150? I remember having what I thought might have been a heart attack at work a few years ago. My husband was dying of cancer, and it turned out it was stress-related. I actually opted to be taken by one of the people in the staff to Montague, and they did provide good care. The second time it happened, I decided to order an ambulance, and I had a bill of $150 waiting for me, and I was working on a low-wage income. So there are a whole lot of issues, and I'm not expecting you to respond to that. I'm just putting this out there. Transportation, foot care costs, all these other things that help people in low incomes and fixed incomes stay at home where they're probably going to be doing a lot better. Does that enter into any of the estimates and analysis? The other and last concern I have is I have a real concern about this private-public partnership. And that model was used with hospital buildings before in other provinces, and it was considered here in PEI. I see this ambulance service as on that model, and I wonder about how do you make your money, your profit? You don't have to answer me, because I think there has to be a cost analysis done by an independent body to determine how much money we taxpayers are funneling into a private business and how much profits you're making, it just doesn't make sense to me, you know? And I think we deserve, as taxpayers who are helping to pay for that kind of service, I call it the mobile emergency room service. I think we really deserve to have that kind of information given to us now, not later. And my last comment is, why couldn't you have sat down with that vibrant community in Surrey and up west, and I'm sure in Montague I know that there was concern and a group of people working. Why couldn't you have sat down and let them tell you, this is how we see things working? And I'm sure they would have been open to some compromises, but you don't go and open up the barn door, the horse is long gone down the road, and we're dealing with the half, needing repair cart. So I don't want any responses. Those are my comments. Thank you.
Thank you.
Hi, I'm Alan McPhee with Island-Wide Hospital Access. I have a few comments from the meeting tonight and one question for the minister. Because, as was noted earlier, being from Surrey, Montague is partly our community's hospital now. Doesn't mean we'll vote for Richard Collins yet, but only if he supports keeping Surrey Hospital open. But in Surrey, it's, first, I think, Dr. Wedge, it's somewhat misleading of you to tell us that we have 4 ERs in Surrey, or on Prince Edward Island. We have 2 ERs, and we have 2 ERs that are operating at 50%. So we have 2 full ERs and 2 half ERs, not 4 ERs. And the reality of that is in Surrey, where there's no ER, you can wait 43 minutes for an ambulance on a regular basis. That's not an unusual thing. Or drive to Montague, and if you're not attended to by a physician before 10 o'clock, you go to Charlottetown and wait there. It's obvious to me that the minister and his constituents don't wait 43 minutes for an ambulance. And it's also obviously to me that the gentleman representing EMS didn't quite hear the message tonight. He said, I heard you say that you thought you were confused in a response, that we were confused by your responses. I don't think we were confused by your response, sir. I think you're not in touch with the reality of what's going on, and the reality is that ambulance service and ER service in rural PEI is simply not safe. I think, to my question, the Department of Health has spent approximately $2.5 billion, a little less, over the last 5 years, and is projected to spend over $3 billion over the next 10 years, which is is projected to spend $3 billion over the next 5 years. So over that 10-year period, it's over $5 billion. On an annual basis right now, there's about $200 million in the health budget per annum that's new money to this government. So of the over $5 billion being spent in that 10-year period, 5 past and 5 forward, there's about $2 billion in new money. Yet we keep hearing in the newspaper people rolling out this vision of acute care in one center and national models. And what we read is in Saskatchewan, they went to super centers and they didn't work, so they're now supporting rural hospitals, which is the national trend. And we seem to be going counter to that trend. Tyne Valley is closing, or announced to be closing. I think that's going to be fought and hopefully revisited because there's no need for it. But I think that this is driven by some need to be a national leader. And on PEI, it's about keep the shop. It's not about national leadership. If there's one thing that came clear tonight, To me, it was that if you want sensible and fair healthcare system, that you should ask a retired emergency nurse from Wood Islands, because she's from Murray Harbor. That lady was right on the spot. So, of the $2 billion, my question, sir, and this is to the Minister of Health, of the $2 billion in new money that's being spent over a 10-year period, how much of that is committed to renovation, expansion, construction of the Montague Hospital? And please compare and explain the difference in the budget to the Montague Hospital versus expansion money spent at the Queen Elizabeth Hospital.
Well, first of all, Alan, I'm not going to get into a financial rant about a breakdown, but I want to tell you something. Right now, my priority in this province is to provide health care for Islanders tip to tip. We have individuals living in communities all across Prince Edward Island that get good quality services in their own community, and they get good quality services at the PCH and at the QEH. Islanders are getting health care in Summerside at the PCH and the QEH. We're also responsible for the outer province budget, which is exceeding over $50 million, and there's all kinds, as Matt Crossman indicated. We've got 5 ambulances a day that are transporting Islanders to the VG, to the QE2, to Chambers in Fredericton, to St. John, to Moncton. So it's not just, from my perspective, obviously in my role, I have to look at the whole province from a service delivery perspective. And certainly I respect all the concerns and the issues. That's the challenge I'm facing. We basically, just an example, physician budgets, physician salaries in this province in 2007 was approximately $60 million. Today, physician salaries in this province are approximately $105 million. So approximately 72 to 73% of all healthcare costs are for allied healthcare professionals. So it's about service delivery for all Islanders in your own community. It's about services in Charlottetown, Summerside. 32% of all the surgeries that are done in Summerside are east of Summerside to the beyond Surrey. So there's services being provided. We keep hearing this $23 million comment about, well, that is correct. That is the community budget. But there's another $80 million of service delivery that are wrapped around all kinds of communities in Prince Edward Island. We had questions on home care. Home care budget in the last 5 years has gone from $9 million to $23 million. Primary health care budget has almost doubled. So investments are being made, but there's huge challenges in the system. And I've heard you stand up for weeks and weeks and weeks, and I've yet to hear a solution.
A solution's coming. We're doing our work. You hit us with this announcement pretty quickly. So we'll be doing our work over the coming months. Good. I can appreciate your concern that you don't want to get up there and rant. I think that's proper. But my question is there any capital investments planned for the Montague Hospital? And I'd like that compared to the Queen Elizabeth Hospital and explain the difference.
I don't have the capital budget breakdown, but certainly, as I alluded to, the ambulatory care center, the emergency room, the cancer treatment center at the QEH serves all Islanders, not just people in Charlottetown. As far as a breakdown, I'll certainly be more than happy. I don't have a capital budget estimate book here right now with me. I don't have that, but I'll be more than glad to get that to you.
Thank you.
Hello, my name is Nathan Bushy. I'm from Surrey, and I'm a member of the Island-wide Hospital Access, and I have a statement more than a question.
Very nice. Any comment on that, I guess? No? Okay. Ronnie Nicholson, I'm from Montague area, downtown Brooklyn. I'll be very brief. Lots of anger here tonight from everybody, but I think not a murmur about prevention. I mean, it's what, 42% of the budget. I mean, I haven't passed up an opportunity in the last few years to put my foot in your government's neck. That's for sure. But in all fairness, I mean, what's being spent on prevention? Perhaps the CEO could. It seems like the status quo doesn't want. Nothing's happening.
Yeah, there are actually a number of initiatives underway in prevention, mainly in the primary health care field. There's obviously the screening tests that are done for Pap tests, mammograms, colorectal screening just started in the last few years. We have COPD initiatives to try and keep people out of hospitals, out of emergency rooms. We have an obesity initiative that's underway, a hypertension initiative. Those are the ones that are kind of come to mind, but there are a number of prevention strategies. There is also a wellness strategy that's being developed actually at the department, not at Health PEI, for Islanders as well.
This needs some attention. This should be attacked aggressively.
I agree. Yeah.
Because without that, well, and I mean, not, we're a very unhealthy population. I think you'd agree on that. And the status quo doesn't really seem, maybe I'm a bit cynical, but I don't see it changing. It'll soon be over half our provincial budget. I'm assuming within 5 years. So where are we going in this?
You're right. We are a very unhealthy population. We're very unhealthy compared to the rest of Canada, actually. As you go from BC towards Atlantic Canada, we get more and more unhealthy. We have the highest rate of smokers in Canada. We have the highest rate of obesity, highest rate of chronic disease, multiple chronic diseases.
Anyway, I'll let you go out. There's other people waiting.
It is facilities like this, the wellness centre here, that people need to get involved in.
Well, I mean, that's only a small part of it. I mean, we're all complicit in this if we don't.
Yeah.
I think you've failed. You've had an opportunity, Minister and CEO. I mean, anyway. Thank you.
Hi, my name is Beverly Acorn Lemieux, and I live in Beach Point. That's down Murray Harbour, Murray River Way. My husband and I were on the waiting list for a year for a doctor on PEI, and we were assigned a doctor in Charlottetown. That's a 45-minute drive. And fortunately, I am a grateful cancer survivor, and my oncologist, Dr. Dreyer, has just retired. And I was grateful that I was able to see her in the Kings County Hospital. So I would like to know if, now that we're down to one oncologist on Prince Edward Island, if that service is still going to be available in the Kings County Hospital. Will we still be seeing an oncologist coming to the Montague Hospital to see cancer patients?
Following the retirement of Dr. Dreyer, actually maybe on Friday or perhaps tomorrow, I'm not sure the exact date she's retiring, there won't be a service at the Kings County Memorial Hospital for the foreseeable future until recruitment is back up to par. So we usually have 3 medical oncologists and 2 radiation oncologists. We still have 2 radiation oncologists actually who work through the linear accelerator at the Cancer Treatment Center. So there is recruitment underway for the other 2. Once we're back up to staff, the intention is to continue with the cancer treatment service in Kings County as well as in Prince County.
I'm sorry, what was that last statement?
We have satellite cancer treatment centers in both Kings County Memorial
Yes, you're
as well
going
as
to
Prince
continue
County.
that in Kings County Hospital?
Once we're back up to staff, the intention is to go back to Kings County, yeah.
So you're not going to continue that at the Kings County Hospital until you hire someone, hire an oncologist.
Right. The oncologist is going to be based at Charlottetown only.
Okay. And Dr. Champion, I would just like to read a letter from Dr. Champion, or an article from Dr. Champion. Statement, I guess. The volume of work in oncology has increased as treatment options increased over the years, he said. Yeah. Mm-hmm. Losing one very busy person out of a very small group, and he's referring to the small group of oncologists, is a big problem in the long term. Champion said some islanders may find the center in Charlottetown is too busy and will choose to have treatment off island. Do you know when this statement was made by Dr. Champion? In 2011. Yep. And he found that people were already finding the treatment center too busy and would have to go off to Prince Edward Island. We have people on Prince Edward Island that have to travel off the island to get their cancer treatments. Are you providing that transport system through the ambulance service? Are they getting transported over for their treatments?
Not by ambulance. There are actually very
They're
few.
paying for their own treatments.
We had a meeting with Dr. Champion actually about a week ago. There are very few people that are transferred off island for cancer treatment, despite the fact that we've been short an oncologist for over a year. And of course, Dr. Dreyer just retiring recently is going to make that situation worse.
But you knew Dr. Dreyer was retiring. This was no news that Dr. Dreyer was retiring. She's been retiring for 2 years.
And the recruitment staff have been looking for an oncologist. There are not a lot of extra oncologists out there. There are a number of locums who have come into the province to provide care. There are medical oncology associates who are people that only need another year or so of training that are working with Dr. Champion and are currently located in the province helping him now. So the service is continuing. It's not nearly where we want it to be, though.
The service is continuing in Charlottetown. It's not continuing in Montague. So when you said earlier that all of the services were remaining in Montague, nothing was changing in the Kings County Hospital. It is changing. That's a huge change. The people that have cancer on Prince Edward Island are under enough stress as it is. And I believe that there has to be a problem that you did not know. And Dr. Khan left Prince Edward Island in 2011. That's 2 years ago.
Yeah, I'm very
and
aware
we
of that,
knew that Dr. Dreyer was retiring 2 years ago. And we
very
still
aware.
only have one oncologist on Prince Edward Island. And that one oncologist is not going to be available on call. How much do we expect that one person to do? And we've lost this service in Kings County. We've lost the service in Montague Hospital.
Mm-hmm. So Marnie, I think, is probably going to fill you in with what's going on with oncology recruitment.
I think if I can just kind of share with you a little bit of our efforts on medical oncology. It is a challenging position to fill. We have a number of recruitment firms right now providing support to us in order to help find some appropriate candidates for medical oncology. We've been sending notices out to every program director in the US and Canada to send out to all of those who are completing their training to make sure they're well notified. We've done a huge number of advertisements as well. We have 5 candidates who are very good, who we are currently reviewing. We have a site visit coming in May. We also have WebEx video conference interviews, which we start with prior to bringing them for site visits to ensure they're good candidates and that they ask all the questions they need of us on what the service is, and we provide it to them. So our efforts are continuous. We also have some locums, shorter-term support coverage that's being provided as well from in some of the summer months and into the fall. So we are working very actively on recruitment of medical oncology for this province, and it's been one of our key focus areas. So just so you're clear on kind of the activities, and we will keep you up to date as soon as we know.
You ever think about offering them a little more money? I mean, cancer is a big problem here in PEI now, one of the worst cancer incidents in Canada. Did you ever come across that maybe these will come if you give them more money?
Actually, I have...
You're not going to have 25 here.
No.
All you want is about 3 or 4.
And I've brought that forward, actually, just within the last 3 weeks to see if there's any opportunity to provide an enhanced recruitment incentive to bring them here. And we have received agreement to do that. So we are looking at some additional funds in order to support that. And if we get 2, we will provide it to 2.
Michael Redmond, leader of the NDP on Prince Edward Island, and I thank you very, very much for taking the time out tonight for coming. I'll be gentle with you, Doug, I promise. Just a couple questions and maybe an observation. And I think when you hear the people in the room, and it doesn't matter what communities we're in, there's a lot of anxiety and there's a lot of mental stress because people are very, very worried about their communities. And I think that we need to really take a step back at some points and reevaluate our situation when it comes to healthcare, because we have to understand that fishing and farming and tourism are important industries in Prince Edward Island, right? And we have to look at the long-term future. So I think you can just hear it in the room, and sometimes people are very passionate, and it's a passionate issue. So I think we have to all take a deep breath, and let's work together and try to find a solution. And it should be a nonpartisan issue. It should be an issue about Islanders, and we should be, as a collective, willing to listen to everyone, right? Engage everyone, and do it on a professional level as well, and be polite. That being said, I think it's really, really important to look at some statistics, and I'm concerned. And Doug, I think you said that the healthcare budget in the last 5 years has gone from about $360 million to about $570 million. Do you see that trend continuing?
Well, the trend for healthcare growth in the last 6-7 years is probably in around 6.5-7% per annum. That is unsustainable. It's completely unsustainable. It's going to crush other government departments completely. The challenge is containing that budget growth. Last year we committed to a 4.1% increase, which was the 4th highest operational spend in the country, behind Saskatchewan, Alberta, Quebec, and then we finished coming in fourth. This year, we're at 3%. The challenge is to try to manage a cost-driven system, which is a demand-driven system, at 3%. That's the challenge. So we talked about here tonight, and Ron Nicholson raised a good question around the high volumes of chronic disease. There's no way that the Prince County Hospital and the QEH are going to be able to can handle any more volumes. That's why it's so important to make sure that we keep pushing services and maintain facilities out to keep places viable. They are going to play a different role, but there's no beds being closed. They're playing a different, because there's people coming in. There's 1,000 Islanders a day coming into Charlottetown and Summerside for services. They're coming in from everywhere. And it's just because we've got an aging demographic, and we've got, as Dr. Wedge alluded to, we've got, from a population perspective, our overall population health is extremely poor. So that results in high volumes of chronic disease, hypertension, diabetes. I mean, these are just the real realities. The challenge is trying to contain that growth, but continuing to provide good services in different locations, and particularly off-island as well.
So don't go anywhere, because I'm not done with you. Just like the table, no, and I appreciate you taking the question. Yeah. So if these trends were to continue, and you're to think about the transfer payments from Ottawa decreasing, because that certainly sounds like what's going to happen, right? We're going to be stuck with this, with Prime Minister for at least a couple more years regardless. So this is the trend that will continue. Right?
What we're seeing, I mean, there's not going to be any changes anytime soon, but we are pushing a conversation. We are trying to manage. We've made substantial investments in primary health care. Primary health care investment is about keeping people out of acute beds. Right. It's keeping them out. Right. And that's what we talked about, the 5 primary health care networks, and we saw some slides earlier. We want to get the appropriate services in at the appropriate time by the appropriate provider. We want to keep people in their communities, out of those acute care beds, and leave those beds available, particularly at the QEH, for our most sick Islanders. Yeah. And they could be coming from Tignish, or they could be coming from Surrey. That's it.
Sure. So from my perspective, there's a lot of determinants to health. Obviously, affordable housing, job security. So. Yep. You know, we have an aging population, sure, obesity, and you're touching on there's 1 in 4 kids living in poverty. Yep. 17,000 people in this province live below the poverty line. And, you know, Paul McNeil's in the back room, and I'm sure he could tell you that I can't remember if it was his son or daughter, I'm assuming, doesn't want a physical activity to be pool when it comes to the education system, right? So we need to take a very, very serious look at our education system, along with our healthcare system, with our community consultations, and we need to get our kids moving. We also have 34 NGOs of some sort, 600 or 700, and I've spoken to a lot of those service providers, and they're people with disabilities and mental health issues. They're not physically active, and they will be a detriment to the healthcare system in the long term.
Yep.
Right? The other issue, and I'm very, very disappointed that we have a finance minister who cannot see the ills of his way by investing money or gambling our money into gambling. When our addictions and PEI are through the roof, whether it's alcohol, it's drugs, we can't afford to be continually throwing money into those lost ventures at the detriment of small communities and to our populace.
Yeah. Thanks, Mike.
So my last point.
Yeah.
I have a solution. Do a long-term health care study, put all the numbers on the table, look at all the services provided, engage the communities, come up with a solution that the communities are involved in, and we'll have some tangible results. Thank you.
Thanks, Mike. Okay.
Hi, I'm Pam McKinnon. I'm with the Island-wide Hospital Access, and I actually don't have any questions. I just have some comments to you folks. This is a government that has no long-term planning. From what I can see, it's a 4-year term plan from election to election. They build manors, brand new big facilities, with not one extra bed that they replaced. This baby boomer stage is about to come on. They project that they're actually giving us some beds here, when additionally they're just funding privatized beds that are already full. We're just shifting people around here. We're not gaining any extra solution to this problem. They consult physicians who want to live a balanced life, and they're allowing these physicians to run our healthcare system. The minister says there's no beds closing in this health care program. Well, I can guarantee you there is. There's 2 palliative beds that are not going to be in our community. There is, through the guidance of a 9-month committee with Dr. Wedge, we come up to some solutions to be able to provide some services in our community. And within 15, 16 days, that 9 months of hard work was just shut down. And we were closing. We're not sure. We're closing in June, according to Cecil Villard. It's not till the fall, according to Minister Curry. And we no longer have health care in our communities if this goes through. The Mi'kmaq have lost access. When you talk about chronic disease management, well, we don't have any oxygen now or blood services for diabetics. Instead, we have finger pricks. We have allergy. People with high allergies, they can't make it to a service now. An allergy to black flies, they will be dead. So our hospital has had the same progression. We used to do delivery and babies. We used to do surgeries. We had an ER. We had outpatient services. And bit by bit, in 2004, 9 years ago, our ER closed. And in 2013, we will be closed. No hospital. And I tell you this, promises and words are cheap. The Premier sat face-to-face with our family doctor, with the chief of the Mi'kmaq community, as well as other representatives of our hospital. And he said, as long as he was Premier, we would have a hospital. He talks about silos. This government and past governments continue to fight community off of community. It's who's keeping the ER, who deserves this, who deserves what. That's the only silos that are created. So when Prince County Hospital talks about the battles that they are having internally the last 2 years to try and keep their services, whether it's emergency services, then you can guarantee we are just looking at centralized health care for this province. Thank you.
Thanks, Pam. Just a couple of things just want to clarify. Obviously, in 2007, when we came into government, we made a commitment to replace 5 public manors that were in pretty rough shape across the province. That investment is almost complete. We basically have spent $70 million in that project. And she is right, there was no new beds added to the manors, the public manors. All the new beds have been added to the private sector, whether it be Andrews and Summerside, whether it be Gillis Lodge, for example. We've added an additional 170 to 175 beds. Actually, our wait times for long-term care are strong in respect to other aspects of the region, and I just wanted to clarify that point. In respect to comments about the PCH, I'm not really sure where that's coming from. I keep continuing to hear that, but actually right now we're in the process of trying to look at repatriating services that are currently being off-island to bring to the Prince County Hospital, as well as expanding medical education to the Dal Med School there as well. So just to make a few points on that. So thank you.
Good evening, Minister and panel. My name is Michelle Johnston. I'm 50 years old, and I was born here, raised here, and I love it here. I have suggestions. I don't have questions. I'm glad that the last person spoke and raised those issues, because my suggestion is going to see an increase of 13 beds, but here's where everyone's going to kill me. It's going to see a decrease and a closure of 3 hospitals. Right now, Prince Edward Island is an island of 146,000 residents. In the eastern end of the province, we have 2 hospitals with 47 beds. In the western end, we have 60 beds in 3 hospitals. My suggestion is we have 1 hospital in the east with 60 beds. We have 1 hospital in the west with 60 beds. We keep our Prince County Hospital and we keep our QEH. Those beds can be used, 40 could be acute care, 20 long-term. That way we have staff there to staff our ERs, and we have a full-time ER in 5 hospitals across PEI, which is what we need here in PEI. That's my suggestion, and thank you very much.
Hi, everyone. My name is Bruce Van Buskirk. How are you, Doug? I'm just gonna ask you, when are we gonna get our detoxes back? Detoxes. I've heard talking about everything here tonight, but you have one there in Mermaid, and you might as well have nothing. Now, I'm an alcoholic, and I'm an addict. I might only have grade 7 education, but I've been from here to out west to back. I've been down every goddamn street there was to go down, you know, and you can't lie to me. You can't fool me. Because I was all a liar and everything. And I'm not scared to admit that today. But it's what I feel sorry for. You had one in Prince, you had one in Queens, and you had one in Kings. They're gone. Now, I know you fellas might not have anything to do with it.
No.
But they're gone.
Yeah.
And we need that. Because there's people out there that's alcoholic and they're still suffering, and I mean suffering. Also with the drugs. And if you think it's not going to happen, there's kids out there now at 10 years old that's in them schools that's doing drugs. And they're turning around, they're trying to blame the doctors. Yes, maybe the doctors is giving out pills and stuff, but they're not giving them to the kids, but if you know what I'm saying.
Yeah.
Okay? But what is happening, it's getting in here. And it's not all kids. You got older people that's on it, up in their years of 50, 60, you know, and they're dragging all this shit across the island, you know, and God love the dear little kids. And you know, there was an accident there that happened this week, and you didn't hear anything about it yet. But a fellow that they pretty well got busted up. And, you know, that's all. To me, I got 31 years sober and straight. And if it hadn't have been for the dear people down in Surrey, I wouldn't be standing up here talking to you tonight. Now, I'll give you credit. I'll give you all credit for having the insides to get up here. And, you know, like, I mean, that means a lot to me.
Yeah.
And, I mean, I got a freedom of speech, too. And when he's talking there about the ambulance, I used to drive tow truck in Ontario off the 401. And I hauled a lot of blood and guts off. Yeah. And I know what it's all about. Mm-hmm. Not that I know everything. But I'm an underdog, and I'm speaking for us people, us alcoholics. I haven't got a place to go tonight. Yeah. I haven't got, because they won't let me in. I either got to be drunk out of my mind, and where are they going to send you? Into Riverside. Yeah. No, we need places where people like myself has had the experience and can handle. Yeah. And Sandra's not here right now, but she could tell you what we were like when we come into the ER. We're not very nice people when we're drunk.
I know.
You know?
I've got obviously like a lot of families in this province there's some real issues with addictions. There's no question, and certainly I'm not foreign to any of that. I guess in respect to your questions, first of all, I want to thank you for raising it, because we're talking a lot about in the meetings about acute care, primary care, home care, and so on. There was a decision back in the late 90s to eliminate a high volume of detox beds here in the province, and I'm sure the government of the day had the rationale and the reasoning for that. But you raise a really, really good point. Obviously, we've got a mental health and addiction review. We had a great discussion in the Legislative Assembly, and I think it's an area that we need to continue to pay more attention to. Right now at Mount Herbert, we're seeing the scale has tipped. Traditionally, it's an inpatient detox facility for recovering alcoholics, but we're seeing a shift from alcohol to a high-end dependency on opioids, painkillers, narcotics. Obviously, I bring in legislation last week just to tighten up the surveillance, because the frontline workers have communicated to me and told me that it's not just the drugs that are coming from outside the province into the problem, which enforcement would say is a reality. I recognize that. but there is a big issue with the high level and the increase of prescription painkillers that are getting out and that are ending up in medicine cabinets, that are getting into adolescents' hands, that are getting out to parties and so on. I recognize that. You raise a great point, and I thank you for that. Certainly, I've got a real interest and passion in the whole area of mental health and addictions, and hopefully we'll be a government when it's all said and done that will demonstrate that we've made some positive steps forward in that whole area. Thank you.
Well, that's one thing I got to say is when it all comes down to the point, I don't care whether it's Liberal, Conservative, NDP, you know, this is human beings, human lives that we're fooling with. And Doug, I just ask you to please try and do the best that you can because it's needed. Thank you very much.
I didn't want to get up to the mic because I wanted to make sure that all the folks from Montague had their say. And my name is Susan Bird. I live in downtown beautiful Fortune Bridge. And the community Kings County Memorial Hospital would be my emergency room. A couple of weeks ago in Surrey, I had the opportunity to ask the minister if he had read the Corpus Sanchez report. And I think he was a little bit, wasn't quite sure if he remembered back that far, but he did at the end say that he read it back in 2008 or 2009. I've read it many times since. In fact, I've been tracking your progress. And I'm delighted here to hear that Montague has an assurance that there are going to be no changes to their hospital here tonight. And my comment to you would be get it in writing, because the Corpus Sanchez report, which is the blueprint that your government is working on for changes, and I'm not going to get into commenting on changes. I spent 20 years in healthcare, and I did work here in Montague, so I'm one of you as well. And but there are a couple of things. This is a 102-page report. And starting on page 57 to 59, 4 pages are devoted to the community hospitals. Montague, O'Leary, Surrey, and Tyne Valley, and Alberton. And one of the comments, or one of the charts that's here, and these are your figures, not mine, and I will start by saying I think this is one of the most flawed reports I've ever reviewed in my life. But anyway, we'll have another conversation about that another day. But for the Kings County Hospital, surplus days expected to be retrieved after implementation of these changes is 1,991 days, or 56.4% of your 2008 admissions. Now, I don't know how you're going to decrease almost 2,000 patient days with no changes in your hospital, but I wish you good luck. I truly do. The other thing that I would say in regards to ambulance calls, Matt made reference to the fact that they didn't have a computerized system that could do the rural areas. We in the East don't consider Surrey too much of an urban center, so if you can track us by our postal code for billing, you should be able to track us for rural areas. And I assume everyone's getting their bill. Thirdly, the community health center model, the minister said that this is a relatively new model. We tried to implement that in 1990 in Surrey. That's how new it is. The community health center model, your collaborative health center that you're putting in up in Alberton, 1990, we tried that process. Yes, we did. I was there. I was the CEO. It also has been in operation in the north since Christ was a cowboy, and it's been operating in northern Ontario, and it works. And that is an answer for rural areas for sure, because we're not going to see doctors sitting in emergency rooms 24/7. And finally, just for the kind folks of Montague, the summary of the 4 pages in the recommended strategic direction for community hospitals, I'll just read the last sentence. These hospitals, the ones I named, would be supported by acute care services that would be streamlined and delivered primarily at the 2 larger hospitals. So I'm glad to hear tonight that there are no changes at Kings County and they're keeping their acute care, and hopefully their emergency room will reopen. And finally, I guess, to add some levity to the thing, you need to remember what Mark Twain once said. First get your facts straight and then you can distort them.
Thank you very much, Susan. The Corpus Sanchez report was obviously given to government, like I say, back in 2008. There was a number of recommendations that were there. not all those recommendations were accepted by government. I shouldn't be speaking on behalf of government, but they weren't accepted. They weren't accepted by healthcare management either. And so basically it was tweaked and made into sort of a PEI version of the recommendations, if that makes sense. Yeah, so we're not actually even using the Corpus Sanchez report in any of our work now. That was done 5 years ago. So we did a couple of years with Corpus Sanchez to make some of those changes. We have made a number of investments in primary care, as according to the report. We've made a number of changes in transitioning, what we call transitioning, to go from hospital to home or from hospital to home care, from one facility to another. So those transitions were part of that. The utilization management sections, we used the whole swaths of the Corpus Sanchez for utilization management. So what I'm saying is we used, as far as we're going to go with the report over the last, well, up until a couple of years ago, but we've moved on to, with the system, the same as any other system that evolves. It's always evolving, right? Yeah. Well, and again, it had to be put in a PEI context and given the cultural context of PEI as well. Yeah.
Debbie Johnson, Town Councillor with Montague. I'm sure everybody's ready to go home, so I'll be very short. I just have a question on all these changes. Some of them need a lot of, I guess, rereads. But will these have any impact on our ER wait room wait times? Like, I know the Charlottetown ER is just, the wait times sometimes are unreal, and I'm just wondering if you can give us an idea of what impacts we're going to see in the Montague ER. I've been to Charlottetown different times when the Montague's been closed, and they've said your best option is to go to Prince County. Very, very good service in Prince County. I'm just wondering if you can give us, that's my first question. My second question is extended care. I think we still need to keep some human component here in the healthcare system. We need to say if you have a 95-year-old patient, we only have 2 extended care facilities. I'm not sure, I didn't hear how many extended care beds will be left in Montague. I understand there'll be some. But to keep transporting elderly people with dementia and Alzheimer's, you know, the stress on them, I think we still need some human, have to take into that concern with patients. So I certainly wouldn't want to see a 95-year-old patient with a 90-year-old wife that couldn't drive and them in O'Leary for extended care. And another thing is all islanders don't have access to personal transportation. We don't have public transit out here in Montague. And I'd certainly like to think that after driving to Charlottetown for 25 years to work, that when I retire, that I'm going to have a hospital in Montague. That's my main concern here tonight.
Mm-hmm. Yeah, no, I do agree. You do have to keep that human element in there. And obviously, when the discharge planners at the hospital are looking at transfers, they do have to take all that into consideration as to what's going to be detrimental to a patient. Obviously, we don't want to go down that path. So I do agree. In terms of the emergency room at Kings County Memorial, a number of changes hopefully will come. So as we get better services put into primary care in the Kings County area, we should have fewer people going to the emergency room for primary care. As the lady Marnie alluded to, if we can get an 8th physician in the in Kings County at Montague, then fewer people will be left without a family doctor, and they can be seen in the office. If you look at the stats for the Montague Hospital, about 40%, 45% or so are what we would call true emergencies. So those are level 1, level 2 with people that are fairly sick. And then, but a great big bulk of that 45% are actually what we call level 3. A lot of those can be seen in an office, and a lot of them are appropriate for an emergency room. So as we get more people into primary care, fewer people in emerge, and therefore the wait times drop.
Well, we hope that's so, but there's also a lot of people that don't have a family doctor in Montague. Right. I had a mother that didn't have a family doctor for 5 years. It was just to get her prescriptions renewed. She had to sit in the emergency room. I agree. But I certainly hope that's the case because, and we'll look forward to that. Maybe we can get a few more details as well because I think you all, I'm not sure, but I heard Murray River, something to do with Murray River mentioned here tonight. Yeah. And we haven't heard any details on that. And then I'm not sure what the plans are for changes at the Montague ER.
I was going to see if Yeah, so there aren't any changes planned for the Montague ER. It's still going to be a 14-hour emergency room facility staffed by the family doctors from the Montague area. In Murray River, I'm not sure if I got the right slide there, but there are a number of services that are being offered there with between home care, diabetic care, some advanced care nursing. Marilyn talked about the nurse practitioner, that vacancy that's here that we hope to have down there at some point as well.
Yes, that's what I was referring to, but that isn't there at
So
this
there are a
time.
number of services there, but there aren't any what I'll call primary care medical services or primary care nurse practitioner services yet in Murray River.
Yeah, no, my concerns were just on the number of people and the wait times increasing at all the areas, I guess, in the province, just to do with the changes. And I guess most of us feel that better access and better care is still closer to home. Thank you.
Yeah. Yes.
Well, thank you very much, and I think that's a good night. That's 3 hours of good questions, and certainly, I want to thank you for coming out tonight. I mean, health. This is a very, very important conversation. This is a tough conversation. It's a very tough portfolio. It's a very emotional issue with no easy solutions and no quick fixes. And certainly, as the minister, my objective is to continue to make sure that we have good quality services. It may not be identical services from community to community, but we have the best access to what we can provide. So I want to thank you for coming out. Thank you for your questions, and thanks for your time. Thank you.